Connie Garofalo here, and Zoe Smith also.
Thanks, Steve. Again, I'm Kathy Chandler, the Pitkin County Librarian, and the reason that we're here today is to ask for an appropriation of money so that we are in a position where we can enter into a supplemental contract agreement with our contractor to carry on with the library renovation. We started construction back in February to work on the addition of the building, and thanks to all of you for coming for the groundbreaking ceremony. What we were undertaking at that point in time was the William R. Dunaway Community Meeting Room and the Evelyn R. Flug Children's Room addition. And so we had funding available in order to make sure that we were able to accomplish that addition and the portion of the renovation of the main library that was mainly surrounding that children's room, the move of the children's room up to the main floor. And this was accomplishing two of the big objectives that we had for this whole project. One of those has always been to have a safe and vibrant children's room, and the other is to have a community meeting room with a nice high ceiling, great AV capabilities that we would be able to make available to the public outside of library hours. So those things are happening, and now we're looking and have been studying for months the rest of the renovation for the building, and are still in the process of getting final price estimates for that part of the project. But staff has worked with the contractor, and they believe that the total budget of that construction for the whole building will be a total of $14.3 million. So we have funds on hand to make a lot of this happen, but we have been in a fundraising campaign, and we had a goal of $2 million, and we did receive some gifts that have brought us up to, now we need to still try to raise $1.5 million for the project. But we are looking to the county to help us bridge our cash flow gap so that we can go ahead and enter into a contract with FCI and start working our way down the prioritized order of goals that we had for the entire project. So I listed those in the memo. One of the things that we wanted to make happen was to enhance the accessibility for the building for people who were confined to wheelchairs. We're bringing the height of the collection down, lower stacks, so that if you're in a wheelchair, you're able to reach all of the books. We also were wanting to make sure that we had great lighting in the building and that it was energy efficient lighting. We did receive a core grant to help with that, and that's included in the funding that's laid out here. We're anticipating a larger teen area because we were had run out of space up in the mezzanine in the former teen area. And we wanted to have a lot of small group study rooms and maker spaces that will be happening now. There'll be a small group study room on each floor, and also maker spaces, content creation labs, a green screen, and sound booth for people working on digital presentations. We're also trying to get restrooms stacked on each floor that are ADA accessible. And we're bringing all of the workrooms, except for the children's library staff, are all going down to the lower level and being grouped together so that the other offices will be taken out and make all of those windows available to the public. Then the architects have worked on a staircase kind of in the middle of the library that kind of invites, it gets light up and down to the building and also enhances the flow. It's easier to find things for the public. So then we wanted to have a small cafe area, and the last thing in our wish list is to update some of the furnishings. So as I said, we don't have the final cost estimates in yet from the contractor, but we have we're drawing a line in the sand here, saying this is how much we are going to spend on the construction inside the building. And if we have to sacrifice things, we will start working our way up that pecking order as, you know, fundraising is or is not successful.
Look at me.
Let's see. I had a couple questions. I'll jump in. The request you were asking for $1 million from, basically a loan from the general fund, so would that take you up pretty close to the total 14.3 million? So you could get really close to completing the whole list.
Yes.
Maybe still be a little bit short, but it allows the construction to go on as if you're doing all these things while we have the contractor there and everything's torn up, and they can do it the most efficiently at that point.
Yes, that's correct. Uh-huh.
Okay. And then as to repay the 1 million to the general fund from the library fund, is that relying on further donations coming in over the next year or two as you're repaying that?
Yes, some of the money is money that's been pledged from people, and so, you know, we don't have it all in hand. One is like a 5-year pledge, and we're also emptying out every coffer that we had. So, I don't know if Connie wants to jump in and talk about this maybe more intelligently than I, but there were things that the library had hoped we would not have to do, which is spend every last red cent that we have. So anyway.
The library has had different pots of money, different fund balances set aside over the years. One for eventual employee housing, one for their large capital reserve, and then of course Tabor and general reserves. And so what they are doing through this supplemental request also is taking the money in their various pots that's left and sweeping it all over into the construction project, leaving just enough to have their Tabor reserve set aside. It's a matter of a cash flow issue, and as you go through the out years, looking out over the next 5 years, they will have funds to rebuild back up their reserves, funds to pay back the general fund, and it's just a matter of trying to, as you were saying, Steve, take care of some of these projects while everything is already under construction. Otherwise, they could wait, do some of the projects later on as they built back up their funds. So it's a matter of timing, doing it now or waiting and doing it later on in the future. So the request is to transfer 1.3 million from the library capital reserve, 20,000 that was left in their housing fund, using 3,350,000 of the library's own fund balance, and then $1 million from the county general fund. And putting all of that together, plus additional donations that have come in through the year, it brings them up to being able to have a total budget of the 14.3 million for construction. Not all of that is appropriated in 2015. In 2013 and 14, about a 1.5 million was already spent on the construction project. They had about $6.7 million already appropriated in 2015 for construction, and now there's an additional appropriation of $6,125,000, which brings the total over all of the years for the construction to the $14.3 million.
George?
So would you say that from the original projected budget that you're on budget, over budget?
You know, we have never really had a budget, I guess I would say. We asked the architect to design the building the way they felt that it should be designed, you know, with the library consultants and library staff. And then we went out and had that priced. And when the price estimates came back, we realized that we were not going to be able to get that much money together, and so we went back to the drawing board and did what we've been referring to as value engineering, and we changed the design of the building pretty significantly. Then I guess I would say when they finish doing the cost estimates now, that's really when we will have for the first time really established a hard budget for this project. What we've been doing is kind of paying as we go. We had, you know, the money that had been left to the library back in 1997 as our starting money, and then we've been doing fundraising and trying to accomplish as much as we possibly could within the means. And as Connie said, we've just got kind of this cash flow problem right now with needing to commit to the contractor when they do come back with that final budget number.
So George, another way I think of putting it is, you know, this is a unique project for us in a lot of ways because it's relying on a lot of fundraising opportunities and such. And so the library has been kind of working through creating a vision, raising funds either through public or private sources, and then designing to what is feasible given those funding sources. And so unlike, you know, what we probably do with our facilities or road projects, in a lot of senses, the scope has been driven by the ability of the library to fundraise effectively and raise its own sources. And so that's the way we've been controlling that then is we've phased the contracting, which is why this is in front of you. We haven't let a contract go for improvements or development that didn't have pretty secure or secured funding behind it. And so where we're at in the process right now is we're at the point of letting a contract go for the remodel of the old portion, which wasn't in that original scope. We've scoped what we think is a realistic budget and financial plan. It does require some cash flow from the general fund. We believe right now that cash flow can be accommodated in a 2-year kind of, you know, cash flow to them, cash flow back to the general fund. If for some reason some of the donations or pledges don't come in as expected, we believe within a 5-year time frame that the tax revenues would cash flow back. So we're solid either way. It's just you know, right now a cash flow issue and whether we want to have multiple mobilizations and increase the cost, or do we get the project done now?
Yeah, I understand that, and I guess I don't want to inhibit or deter any fundraising efforts. But if I were a member of the public and knowing that, well, the county is going to utilize monies out of the general fund to get this project, at least this list completed, it seems like that would make it a little more difficult to fundraise versus saying, well, we'll take a few of these things off the list that could happen down the line, like increasing, updating the furnishings, and do sort of a capital fundraising, just targeting something like that wouldn't happen if the county didn't utilize the general fund.
I think in a sense we have done that in our discussions. I think Kathy's looking for more funding for furnishings and upgrades beyond this $14.3 million. This is the scope that we felt was reasonable at this point. I think Kathy's looking for additional fundraising to up some of the quality there, and if those pledges come in, we'd come back for an additional appropriation. But we wanted to get a project that we felt we could complete so we could sign that. We're getting to a point where we're going to get delayed if we don't get into a relationship with the contractor. And so I think we have that dialogue still about opportunities to improve quality and services at the library, but we need to bite off this chunk first.
Rachel?
Yeah, thank you all for being here today, and I guess more importantly, I would like to thank the donors who have given us the reserve to begin with, former donors and current donors, and people who are considering donating to this project. It's just something that's a lasting legacy for a community. We're fortunate to have many, perhaps intellectual beating hearts throughout the community when you consider the Institute and the Physics Center and so on. But this is certainly a center organ to the health of that system. And the way I look at this, to be clear, is that we have been sure to fund the fundamentals, the physical structure, the increased capacity, and the ability for realignment of purpose and need within the library. And what we're kind of talking about now are some of the finish levels. And I fully agree that while the library is empty and while the library has been moved, it's the time to replace carpeting and tiles and repaint and things like that. And so, I really would like to see that go forward. To George's point, I think it's important to look at what the library's operating pro forma would be once the move has come back in, and should the fundraising not have been as sufficient as one would like, it may lead to saying, hey, we need to create an extra $150,000 in our budget each year from our current mill levy, and how do we do that, and are there reduced hours of operation? Do we only serve Monday through Friday, or Monday through Saturday morning at 2, or something like that? And there's additional hope for donations and contributions would offset that possibility happening, but we need to have a backup plan of plan B or C of what, how the general fund becomes repaid. Because there's, I think from this board, there's no ability for the general fund to make a contribution that's a lasting contribution, other than what we do with our staff support, our legal department support, things like that. There's no question the public should know that the county as a whole, as a system, with Connie's support, finance department support, that we are supporting the library in this going forward. But should the general fund repayment is then critical to the sheriff's office facilities and to the ComDev facilities, and that linkage has to be clear, that this will be repaid by the library over a period of time. And so with that, I feel very comfortable with it. But that's kind of the messaging in my mind, is that we're going to get this done, but there may be sacrifices along the way. And we'd hate to see the sacrifice of hours for a period of time, but we may have to do it right, and then have it something that is funded and constructed to the right standards and to what we expect to see afterwards, and then get it up and running. So that's my opinion on it. I'm willing to support the request.
And Steve, if I could jump in and build on Rachel's comments, because one of the tie-ins I think that we're looking for today that was not in the memos, we were talking to our auditors about the mechanism for these interfund transfers. One of the things that they would like to see is something in writing between the library and the county for the interfund transfer. And so what I was going to suggest is that the board approved the appropriation, and then that the actual transfer of funds happening would be subject to Kathy and I entering into a MOU, me on behalf of the general fund, Kathy on behalf of the library fund, just kind of specifying, that payback expectation and such, so we have that recorded. We may even put it in with the formal appropriation. We need to talk about that mechanism, but in that way we get the appropriation approved by the board so that we can move forward with the contracting and not delay the project. And Kathy and I can document in a little bit more specifics, just kind of those expectations between the two, which I think we have, we've got settled on already. We just need to write down in an MOU or letter of intent.
Great.
Yeah, and that sounds like a good plan to me. And yeah, we do have to be mindful that we're going to need the money for when we start doing our remodel and addition here. So
that's been
that could be part of the
yeah
advertising campaign for the donors.
Well, and let the record show that back when we built the building, you guys fronted us $800,000 and we paid you back.
You have a good credit ranking.
Now, California borrowed $15 million a bunch of years ago, and they just finally paid it off. It was when Arnold Schwarzenegger was governor.
Oh.
So I hope it doesn't take that long to pay back the $2 million. I mean, the $1 million.
We have the 2 to 5 year plan, but hopefully the 2
Yeah.
year.
Yeah.
And just to kind of follow up, have we been applying for grants with larger foundations as well as local fundraising?
Yes, we, Pitkin County engaged the services of a kind of a grant-seeking company a year or so ago, and, you know, they identified what the possibilities were for a public library in Colorado, and they aren't, there aren't very many, but we were turned down by the Gates Foundation, but we did receive a grant from El Pomar for $25,000, and we also received a grant from the Betcher Foundation for $30,000. The thrift shop is giving us $12,000. So we're definitely out beating the bushes. And like I said, we were very grateful for the core grant that we received. And so anyway.
Okay, that's good. That's good news, and I would try Gates again at their next cycle. You know, once you've been able to present new information, how much has been locally raised, what the continuing need is, you just never know.
Yeah, that's a good idea.
Yeah.
Just out of curiosity, does the Carnegie Foundation still have money that they put into libraries? Because that was
Yeah.
huge in an earlier era.
Right. I don't believe so. I could be wrong. I'll check into that, but I think that's a thing of the past.
Okay.
But there certainly are
They
a lot of
built
Carnegie
a lot of
libraries.
libraries across the
Yeah.
country in their day, so. Okay.
Okay.
All right. Thank you very much.
Thank you.
Next, we have future agenda calendar.
Yeah, so a few things for you. Tomorrow, we will be adding an executive session to the regular meeting to discuss property negotiations and also negotiations on a contract. Not sure if the board would prefer to add that at the end of the meeting or to tag on, say, in the morning at 11 before the meeting, if there's any preference. Of course, George.
Contract?
She's getting a new battery.
Yeah. There's two items. One is a property negotiation through open space and trails.
Right.
And then the second is a contract issue on public works
So you're saying
project.
flip both of them to the morning and not have an evening?
I was saying it's an option. We could either do it before the regular meeting or after the regular meeting. It's up to you guys.
Well, for notice, is it sufficient to have it before?
It's,
I know we can go into executive from a regular meeting at any time. I wasn't sure we could shift the start.
I think you can shift the start just like the end for the
Okay.
regular meeting, but if the board is more comfortable, we can do it at the end. It looks like a fairly light agenda, but you never
Yeah,
know.
yeah, I'm comfortable with 11. I just would want to make sure we've hit all the posting and noticing requirements. And if we can, you know, get us an email tonight to let us
Okay.
know it starts at
I'll
11.
double check with John on that.
Yeah, I'd be fine with starting at 11 personally, and then, because
Yeah, you
some of
never
us
know.
have the engagement after the meeting tomorrow that we want
Make.
to allow plenty of time for that. But how about you, George, 11 or?
Well, yeah, I don't have to prep too much for dinner, but.
No hair and makeup, right, George?
Right, pretty easy.
Okay.
So you want to go at 11 or you
I'm
want?
fine, yeah,
We'll
whatever.
see if we can.
Yeah, I thought
Okay,
you
I'll
had
double
notice at
check.
20.
Yeah, send John Ely a quick little note. and see.
Yeah, and make sure that the staff, county staff can make it at 11 versus
Okay,
at
well-
a nebulous time at the end of our meeting. It might be easier for them to have a set time.
Yeah, I thought we'd
for-
have to notice 24 hours in advance for exactly.
Well, we've got a regular meeting already noticed, and we notice it with time subject to change,
Okay.
and so usually we can.
Okay,
Yeah.
if we can, we can.
Make those adjustments. Other item, Carrie Donovan has reached out and would like to do a work session with the board. Right now, the times that are looking, the at least work sessions, it looked like they had the most time on them. August 25th, but Patty,
I won't
you're
be
out,
here.
obviously, and September 1st would be the next one. I don't know what Carrie's availability is on either of those, but wanted to check in with the board about, whether you had any scheduling kind of.
Well, one thing I had suggested with, to Carrie was to perhaps meet with her in a joint session with City Council, because it not only does it help her to hear from both elected at one time, but it also allows City Council and us to have a better understanding of each of our concerns if we want to try to push any certain agenda forward with Carrie. So that's why I had originally had told her to contact you, and then the idea was to see whether first that there was an opportunity to try to coordinate with a joint meeting with City Council or not.
So were you thinking the August 18th or just a future joint
Just a
meeting?
future,
Okay,
whatever.
that didn't translate through when,
Right.
yeah.
Rachel?
I would be okay with that. I think that there's a lot of merit there. I'm just not aware really of how much the city has been involved with legislative matters, kind of through CML or other venues. There's been a couple times when I've tried to push them to get involved, and we certainly have networked a little bit on the state water plan and joint comments and things like that. So, I'd really want John to gauge the interest of the city in doing it that way, because they may or may not have really formed a state legislative agenda to talk to Carrie about. But if they have, then fine, and we should kind of see that we're on the same path. Otherwise, I think it would be very valuable, of course, naturally, to meet with our state rep. And we've all kind of heard the debrief of how last session ended, but to understand what the opportunities are for the next session would be important.
Okay, well, I'll explore the joint meeting, and otherwise it doesn't sound like there's a specific issue necessarily motivating the discussion. Patty, if it ends up
If it
falling
ends
like
up on
on,
the
then
25th, I talk with Carrie
Okay.
pretty much on a regular
Okay.
basis.
So then we'll look into the joint meeting, and if not, I'll get her scheduled one-on-one with you guys. Let's see. The other thing that I'm going to look on adding on the September 1st agenda is there was a new salary bill passed for elected officials. There's some discussion points, I think, for the board in that salary bill, and so just I know there's some dialogue starting statewide with other boards. We're going to plan on bringing a discussion back to you guys in the work session. I prefer on September 1st when we have all of you here, and that should leave us some time if there's any other legislative action around that.
Works for me, I'll be seeing clearly then.
Yeah.
Not that I'm not now, but.
All right.
John, on that matter, there was one thought that I've had after the fact, in that as a home rule charter county, we have slightly different powers than others. And so we were able to address the salary shortfalls in the past with the sheriff, the clerk, the assessor, and those offices. And it's been a little while now, so I can't remember exactly how we benchmarked it. But I think it would be good to have a comparison of what those position salaries would be if it was just, following the straight path as well. I just want to. There seems to be a state path that if you do nothing, these are what happened, and then an opportunity to perhaps change your tier or your category in some way. And so I know we haven't had that discussion yet for the board and for future seat holders, but we should recheck with those other offices.
Fair enough.
Kind of where they would go. Thank you.
And that's all I've got on future agendas right now.
Okay.
I have no issue.
All right, moving on, preparation for the joint meeting with.
Actually, I have something.
Okay.
I'm sorry, I was thinking, should this go under open discussion, or maybe it should go under future agendas? And really, maybe for some discussion time, future agendas is the best home for it. We received, or I at least, and I think you may as well, Steve, an email from Dan Gibbs over Commissioner in Summit County, and they are tracking the insurance rates for 2016. And
Health insurance rate?
health insurance rates. And last year, we were successful in making sure that our region wasn't as small and isolated and discrete to itself, which really pushed our rates up. And we became part of a broader regional state pool. And now the insurance companies in the process, as I understand it, I may not get it entirely correct, they have submitted their potential rates and their potential plans to the state insurance commissioner. And that office then looks at and decides whether to accept those rates carte blanche or to reject them and tell them they need to come back at lower rates, or it's not justified, or this or that. And so we're kind of in a limbo area, but it'd be a possible strong time to write a letter, and I think Summit County is going to have a draft to be able to say, we think these rates should be lower, that the higher inflationary increase, it's far beyond what is really called for in this area. And so we will need to discuss that. We will need to have board time to discuss that, and it'll be fairly soon. So I just would like to add that to a future agenda.
Soon, a quick,
Soon.
have you seen the,
Yeah,
Haven't seen
I've seen different numbers for different parts of the country, and I don't know that I have anything accurate to throw into that. I think one of the things that would be an interesting corollary to look at is that the Affordable Care Act required a refund to ratepayers if a certain threshold was passed, that at least 80% of the revenues that they collected from premiums needed to be spent on health care, and only 20% on admin and profit. And there would be a refund to participants, ratepayers, if those ratios were off. And so in order to establish a good argument on the rates pro-offered for 2016, we should see if there was any refund from any of these, or a refund contemplated by our current providers because of the 80-20 rule. I don't know where to get that research, but I think that would be important to know. Because the first year, there was significant refunds across the state of Colorado because those ratios were not valid. So, okay, I'll leave that there, and we'll do that on a future agenda. Thanks, Steve.
Okay, sure. So, John, what do you have so far on joint meeting with the city of Aspen?
Yeah, so as the board will recall, the joint meeting was originally postponed, I think, for a few reasons. At that time, we had a discussion about facilities, I think, on the agenda, and the city's decision was delayed for several reasons, as well as a Rio Grande recycling IGA. In talking to the city manager's office, we thought it made sense to bring both of those discussions back. We're prepared to talk about the Rio Grande Recycling Center intergovernmental agreement, so we anticipate having our staff and city staff there to talk about their discussions around that. And Kathy's been in front of you guys to talk about that probably about a month ago, I think. I think we would also both be ready to kind of talk about where we're at in the facilities projects. The city did give direction to their staff regarding a preferred alternative to start designing to. I think it would be good to understand, at least at a high level, what they're looking at and how it might interface with the project that we are looking at. You know, there's not been a lot of change in ours. We've been working on the design, but our, footprint and anticipated development envelope has remained pretty much the same, but I'm not sure council is as aware of that.
can I just ask a quick question, Jody, since you're so nicely sitting here in our audience? In light of the city's, I think, direction that they're contemplating, preferred alternative, is to build up from the Rio Grande parking garage level up to the plaza level. And we were very careful with our new meeting space to have this passive light or light issue. Is their new structure gonna, since we don't have a design, do you have any idea if it's gonna interfere? Because that's pretty critical for us. I think we just designed a building for light, and now we might have a structure.
We intentionally didn't put windows on that
Okay.
side facing, and we do have a light and air easement
I knew that,
from the doors out to where they can put a building in front of it.
In the front, on the plaza level, okay.
Yeah.
Because their new structure looks pretty the possibility, the draft designs looks pretty formidable.
Well, and we have been working for the past several years, knowing that someday maybe
Something
that
could
would
happen in that
happen. So
space.
we really had a lot of discussion about that.
Because the space would come up between the existing parking garage and the apartment complex, up that narrow stairwell? Is that kind of where they're planning to go?
Yeah, it's hard to say. It was just a
I think
footprint.
it's too early.
Somewhere in that vicinity.
We did anticipate the possibility that there would be development on that site,
Okay.
if not with this project, with another project in the future when we design the library. So I think we've got that
Good
pretty well
thinking.
anticipated. The only other item that we talked about jointly was the city recently held their council retreat and developed a new set of goals, and we thought it'd be good to step back and have that discussion, kind of hear what their thinking is on their top 10 goals for the upcoming year. We can also recount for them some of our discussion in the retreat and, you know, what we're focused on going forward. And then I'd suggest as a fourth area, just giving both bodies an opportunity to have that future agendas discussion, or what are topics that you jointly want to talk about and plan for in your future joint meetings.
Did we have any thought about, and this might be for future agenda, many, many years ago, we talked with the city about having some kind of annexation agreement. It never got anywhere, and it's my understanding it's even further behind than moving forward. I would like to, at some point, maybe discuss some annexation type issues and see what we talked about it, and maybe, I don't know, if community development is probably well aware of the previous discussions we had. The other issue is, did we decide to put the entrance to Aspen on a future EOTC discussion, George, or did we,
That's what I
is that
thought.
where we were going with that? Okay.
I was going to mention that, we had, when you were out, John, we had a very brief presentation from the Valley Health Alliance. We didn't really have time to really drill into that. And so I don't know whether the city council has had an opportunity to have that presentation, but if not, if VHS is available, that might be interesting to be able to have a more of a broader discussion on VHA and looking at the results from the surveys and things like that.
In the joint meeting?
Yes.
Yeah.
If not on this one, in a future one, definitely.
Okay.
Yeah, I was going to say, I like that, but the half hour we had was so short.
Right.
And if we had to go back over the same introduction with the city, because they hadn't had any presentation before, we wouldn't get to the real, I was hoping someone could explain the statistics to me a little better. I'm just not as good at reading at those.
Right.
And talk about where we go from here, and we certainly didn't get there. So I agree with it, but I think that maybe it would really be worth, and with the city and Steve being participants, it would be important that it really get the right time and then be ready for it.
I do know that the city has reached out to Kathleen and John about coming and doing a similar presentation. And I think now we know to budget more time for that
Yeah.
discussion than the quick overview. So, yeah, we can, I can float that back out to them to see if they're ready for it, or if we want to do it as a future agenda item. But it'd be appropriate since we're partners in that.
Yeah, the half hour we had allotted for discussion here we needed at least an hour.
Okay. I'll
Half
keep
hour
that in
wasn't
mind
long
in the
enough.
future.
Yeah, we didn't,
There were lots of,
meet. We got,
Yeah.
John did a lot of, John Sarpa did a lot of.
A lot of background.
Background,
yeah,
which is good for the public, but we need to go
yeah,
further.
but we didn't get to have a give and take discussion that would have been good.
That might be, again, you'll have to break this in working with Steve into short topics and long topics, what should be the meat of this. But it might be the opportunity to ask them about the joint meeting with Carrie Donovan, and how much do they get involved with legislative affairs through CCI or CAS? Because there really could be some significant roles coming forward. I just keep hoping that we could push something on transportation on the 2016 ballot for Colorado and get something done. But I don't know if that's just one example. But I do think that talking to the city then about a joint meeting with Carrie and how involved they are with CAST, and are there other ways to assist us with some of our legislative efforts.
And Steve, I think that would be an item to see if they do a special 1-hour meeting with Carrie, just to talk with Carrie, because we might not get it on another joint meeting until too close to.
Yeah, legislative session. I see. Yeah.
Because maybe they'd be willing to get together, we could meet on one of their meetings or something, or before, have an hour with her when she could be here. She's pretty good about coming over this way.
Perhaps along that same line, maybe we could just have updates by the city and the county on, what we're working on the water plan, or, any other items that are things we've been working on, and maybe they've been working on things through.
Was that what you were talking about in terms of leaving some time at the end for open discussion?
Yeah.
Just like more of an update, short update on, these are the two things we're working on through CCI. Comments on the water plan are due on September 17th. We're working on that, that sort of just general, so they're aware of what we're working on. They can tell us what they're working on, and
Things that are on deadline. Yeah.
What is it, the Association of Ski Towns?
Yeah.
CAST, is that what it's called?
Yeah, either CAST or CML are their two
Or
main
CML, they might be doing
venues.
something through both of those.
Yeah.
Yeah.
I mean, I come back to really supporting George's concept going forward, whether it's through EOTC or whatever, to begin a real discussion on the entrance to Aspen again.
Especially since the city I just saw the headline, I didn't have a chance to read the paper from yesterday, about the city relooking at their traffic issues.
Well, and
I didn't read
I
the
think it
article.
may come up. I haven't seen the top 10 goals yet
They'll
for
come
council,
from
but I
without
think
that.
it'll
It'll
be
be there.
interesting to see, where and if that fits into their priorities.
And I promised not to bring up the city's issue with rocks and pinwheels and
I still like the median.
and benches in the corners. We'll talk about that at another time.
But that's really all we had, I think, from the joint meeting.
Sounds good to me.
Okay.
Who's hosting?
I think it is our turn to chair, I believe.
It's hard to know. He's flipped
Yeah, I need to go back and look.
Yeah.
I believe it's our turn to chair this next time.
No, with a
I can't
update
remember.
on facilities being some of the main agenda, maybe we should have it here this time. Honestly, we always go over and have it in the new refurbished, great meeting room. And as we're talking about space needs and everything, I don't care if it's a little uncomfortable. It's like that all the time. Let's have the meeting here.
It's so good. I probably won't go
can
for that.
propose that.
If we're
for it,
hosting
though,
it,
if you're-
If we're hosting it, let's have it here on our
With
turf.
food.
Yeah.
I agree with you.
We'll get food and non-alcoholic beverages.
Yeah. Yeah, we can make up with food what we don't have for furnishings, so. I think we should have it here. Okay.
Okay.
Especially
That's
when we
all
have
I've
to
got
put
for ya.
any PowerPoints, will have to be here, so we'll only have this space.
Yeah,
Okay.
okay. So we're adjourned until 1
Uh,
o'clock?
Yep, if there's
that good?
nothing further on this item,
Um,
we just have to fill one out and
Thank
send
you.
it in to CCI.
Yeah.
Yeah, so,
I am planning on attending that date. I will be just flying back in from a vacation the night before, so obviously if the airlines screw up, I'd have to meet it, miss it. But in general, I'm planning on attending. And this is unlike, I believe,
yeah, it's a little different.
the other form, which is throughout the whole season, where Steve and I have assigned committees to vote on.
Right, this is different.
Yeah, this is just a single, and then we can designate someone else from the county to attend. So if it's all right, I would suggest myself being the primary with the seniority and Steve being the alternate if I'm unable to attend, and certainly be there to help argue. You can discuss things at the table together, but they only allow you one vote per county.
Yeah,
Fine with me.
yeah, that would be fine with me. I tentatively am planning on, I haven't looked that far ahead on my calendar, but I've already written that on my calendar just to save the time. Because that is an important
meeting, that sets
meeting,
the whole agenda for
definitely,
the,
when they're really discussing all the different measures that are being brought forward by all the counties. And so it's like voting up and down whether CCI is going to take something on as a legislative priority for them.
yeah. And certainly some they take on at an administrative level and try to solve that way. And we're, from the previous conference call about all the submitted priorities, I really stressed that our transportation one was to open the door and make sure that the issue of transportation funding was discussed and that somebody had brought it up from CCI. And you know, they've asked for potential topics for their big winter meeting first couple days of December, and I've suggested that they really should have a facilitated session with all the counties in the room to talk about what would or could we agree to fund to move forward. I don't know if they'll choose that or not, but you know, we again, for Steve, who's going to be attending the district meeting on the 10th, and I will not be there, not the 10th, excuse me, the 20th. That's the same day as the Pro Bike Challenge. Yeah. So he's got to leave early to make that one. I've got to leave early to have been over to Water Congress. But, you know, it wasn't like a set in stone proposal. It's just to kick off and begin to discuss how can we get some transportation, new revenues, new funding, so that then it would be appropriate to go forward with bonding and bump up. But bonding alone would have been a disaster for West Slope maintenance.
Well, I'll tell you, Rachel, just having driven through Colorado to Utah and driving my son-in-law's diesel truck, the road along the I-70 corridor from Glenwood to Grand Junction is scary to drive.
It's falling apart
because of all of the compression of that road and the whoop-de-doos and the bumps. And then you get into Utah, and they are putting a lot of money into I-15 and sections of I-70 through there. Mostly I-70, the roads are really nice.
Yeah.
And you can really see the difference in funding for our roads in the state of Colorado. It's very, very obvious.
Yeah, it's just falling apart.
I have one other open discussion. I don't know if this is anything we...
Need something, Tammy?
Actually, the maintenance guys come out and said they're testing the fire alarm. They want to know if you guys are going to break at noon because they're going to be
Yeah.
in here.
Yes.
We are going to break it.
Thanks, Kim.
Yes, we will.
We definitely will be out of here.
Tell them just to turn the alarm on once and we'll leave. I'm only kidding.
We'll evacuate. I don't know if
Yeah, very exciting.
this has to do with the gold mine, the Gold King mine issue on the Animas. I don't know if there's anything we can do for any of the counties along that stretch or the affected areas, water issues. I just, you know, we've always been good about going to help out in other counties with emergency declarations, and there has been one, it's my understanding, with the governor. I just want to reach out to those counties to see if anything that we might be able to facilitate with or lend a helping hand from Pickens County. I don't know what the issues might be, but I just want to open that door.
Yeah, and I'd be happy to reach out to my peers. I know in other cases where we've reached out, the response has been because of overwhelm in terms of their ability to respond. This one is, boy, it's like a slow-moving train wreck. You can't do anything about it, but it is a...
I just would like the other counties to know that
yeah,
we are thinking
we
of
can
them
reach
and
out.
we were reaching out.
Absolutely.
And one other thing, did we send a card or something to Rifle
Yes, I believe we did, yeah.
at the loss of their city councilman?
Or about what now?
They lost a city councilman who passed away the day I was leaving for California.
Unexpectedly, yeah.
I had one more just brief item. I wanted to give a short report on, at our day on Sunday afternoon, there was a locals panel, and it was scheduled to be Mona Newton as the moderator, and then myself and Steve Scadron and Mark Butler representing the jurisdictions here. Well, Mona's car had broken down in Frisco, and she couldn't get here, so I became the moderator for the discussion, and then George was added to the panel to speak about CORE as the CORE president. And both of us were like in these new roles that we had to step in at the last minute, but I felt like the whole panel discussion went very well. Everybody gave really good presentations about, you know, what's going on. And Chip Cummins actually gave us an extra 10 minutes because the whole thing was going so well. And usually they're trying to cut you off early at our day because they have a tight agenda, but I felt it went really well.
Glad you guys did that.
And Steve Skadron at that made the announcement that Aspen has achieved their goal of 100% renewable electricity. So I thought that was,
Did he say how they met it?
well, it's through, you know, purchasing things from MEAN, the Nebraska municipal, I can't think of what exactly MEAN stands for, but.
Yeah.
Yeah, it's through their energy providers that they buy energy on top of their
So
existing.
they're
So
buying
that's-
above
it's
and
not
beyond, they're
from-
buying renewables from those energy
It wasn't from
providers.
adding more renewable stuff here, but
Right, I
getting
know
it
that, I
from
just
the-
was wondering how
yeah.
they went about it and how they generate all their renewables that are created through their own electric plant here, but.
Yeah, it's mainly wind that they're purchasing, wind, and of course, hydro from Rudai and the hydro from Ridgeway.
Ridgeway.
oh, also Carrie Donovan was on that panel, and she gave a, you know, rundown from the state perspective.
Great.
So it was a really fun panel to be on, and felt good about it. From this, you know, worrying with Mona not being able to be there, but it turned out all right.
Oh, that's just
We were well received. People didn't walk out of the room, which they did last year at the R Day on the locals thing. The previous thing ended and half the people walked out of the room right when our thing was starting last year. So that didn't happen this year. Okay.
Thanks for doing that.
Yeah. So any other open discussion items? We could bring, if you think of something, we could do it later still. So let's break for lunch. We'll be back at 1 o'clock for Board of Social Services.
Okay.
Will be
When
next
did
up.
we last meet with?
August 11th, County Commissioner work session. Next, we're going to have a special meeting of the Board of Social Services, and I'll call a special meeting to order. And do we need a motion to go into Board of Social Services?
Yes.
Okay, now I'll ask for a motion to go into Board of Social Services
So moved.
session.
Second.
Okay, all in favor?
Aye.
Aye?
Do we need to give Jeanette a moment to set up the recorder?
It's okay.
Oh, it's all right.
She's
Okay,
got
great.
it, she's got it.
Thank you.
Okay. So, Marty?
Nan will be right back.
Okay.
Can we not start?
Nan, we're waiting for Nan here to get going.
I think we can start. There she is.
and Connie also coming. Okay, Nan, we're already convened.
Awesome.
You can start.
Great. Hi, I'm Nan Sundin, Health and Human Services Director, and I'm here with our team. Connie Garofalo is going to be the first one up. This is a Board of Social Services meeting, and the primary responsibilities of the Board of Social Services, which is also the Board of County Commissioners, is to approve the expenditures and to approve the payrolls. So we're going to present those today, and then we have some other kind of miscellaneous updates, and I'm going to spend the bulk of the time, hopefully a half an hour, walking you through the Colorado statistics report, CSTAT, so you, which you all started receiving about a couple of months ago. So you understand how to read them, how we're reading them, and what do you do with them. Okay? So Connie is first up with the expenditures that are in your packet and are up on the screen for the viewing audience.
On page 2 of your packet, this is the budget to actual chart for January through May 2015, so that's about 42% of the year. And looking down at the bottom of the chart where it says total programs, we can see that in both our revenues and expenditures, we're tracking a little behind budget. We've received about 38% of the budgeted revenues, spent 34% of the budgeted expenditures. So that's a little bit behind the 42% if we were exactly at budget. Overall, we're in good condition. There are a couple of items to note. In the first program area shown on the chart, admin and public assistance, we did receive a large fraud repayment in the public assistance area, which has brought up our revenue there. That's thanks to the great work that Eagle County is doing on our behalf in managing the public assistance areas of human services. So we do see higher revenues there. On the expenditure side, the one area that was noteworthy to me is in the TANF and Colorado Works, where we have seen a jump this year in the amount of direct service payments for this program, and you see that reflected also on the following page, comparing quarters on the past couple of years. But overall, again, compared to budget, we're in a good position at the moment. We're waiting for the state to complete the closeout process, which should happen sometime this month. We're not expecting any surprises at this point, so we think we should be in good shape.
For Rachel and Steve, who participate in HHS CCI, in November, we'll bring back here the final decision about, there was a state audit related to administrative allocations, and the state has to pay the federal government back a lot of money. And they've estimated our portion of that to be about $42,000. Some of that is likely because we're almost always overspent in admin, so the money comes in. Anyway, so there's a webinar happening as we speak that we cannot participate in, but we're going to watch the archived one. There are some counties that are anticipating paying it all back, and then there's some discussion about whether or not the JBC is going to hold the balance of state counties to the payback. So we'll see what happens, and we'll come back in November with that, but just wanted to let you know that that's expected. And the Colorado Works program, a year ago we had no clients, and now we have 8 clients. So, you know, that's related to the exceptional work of Eagle County, finding these clients and helping them with work-related activities, helping them get back to work.
Can I ask a question? The repayment that the state owes to the feds is related to non-compliance with some of their standards?
Go ahead.
The audit that the state conducted was a comparison of the CFMS software system, which is where the counties enter their financial information, and the state's own financial accounting system.
I think it was an accounting error.
It was going back over a 5-year period from 2010 to 2014 and comparing these two financial software systems that they found about $7 million in difference over this time period, of which for that 5-year time period about 42,000 would be
Our share.
our share.
Okay, that helps me very much, because I was wondering if we've now gotten to the root of the problem and we're not set up for this sort of continuing thing. So it wasn't a fine for the non-compliance with standards, it was just
Payback.
for
Overpayment.
overcharge and overbilling of the feds.
That's our understanding. We'll watch the webinar and tell you if it's worth it. I think there will be more discussion probably at the CCI HHS level.
Yeah.
There are certainly people who are saying, should we pay it all back? Should we pay part of it back and then hope that it will be forgiven? There's a whole bunch of people out there strategizing how to manage this.
What sources are we compelled to repay from or limited to paying back from? Is this a general fund, or does it come from other existing revenues for these other programs that we just need to squeeze it down until that repayment's made?
We do have human services fund balance that it could be paid back out
Okay,
of.
and so it's not restricted to being able to cure this.
Well, Connie's talking about locally.
Right.
Are you talking about statewide or?
I'm just talking about how Picken County deals with
Yes, right. So we can cover it with our fund balance and then not think about it again, likely.
Just kind of wondering where we
Yeah.
shakes out. Thank you.
Yeah.
Steve?
Yes.
I don't know if you know the answer to this, and it's probably something I should know actually. How does the Colorado Works, the Works program, is it interplay with the workforce programs, do you know? The state has mandated through federal and state law, because I sit on that board and I'm always confused at those meetings as to why I'm sitting at that board.
Workforce Center Board.
Yes.
Yeah. Well, I'm going to learn more because on October 7th, there's going to be a joint meeting with the Rural Workforce Boards and CHSDA, which is the Human Services Directors Association, because of the federal law that changed that requires welfare to work concept.
Yeah.
So they work with the workforce centers and they, and they work with the client. We can be, and Mitzi is working on.
Mitzi sits with me there.
Yeah, we could talk about we can bring up maybe in November. We need to strengthen our relationship with the workforce center up here, and we're working on the whole employment first requirements, and we'll talk about that a little bit later.
Could you zip me off the information about that meeting in October?
Sure, it's a directors association meeting, but absolutely, yeah, I'll send it to you.
Just so I have a heads up on it, because I'm still trying, it's a huge learning curve on this workforce thing, because the activities are really centered in the Vail Valley corridor, and I keep kind of raising my hand, Picken County's sitting at the table, where are we in this whole picture? And I keep trying to get involved in the conversation, and it's like somewhere else in the realm of not our valley.
I can relate to that.
That would be great, because that'll really help me with what I'm supposed to be doing there.
Okay, great.
Rachel?
Just one other tag along with that, and this is why it's good. We meet so regularly and can talk about these issues. I think both Steve and I were in attendance yesterday. Governor Hickenlooper had a conversation mostly about foreign policy at the Aspen Institute with the public. And one of the questions from the audience related to veterans care and veterans services within the state. And it was acknowledged that there's been some increase in the funding for the Veterans Service Officer. And the governor talked about the priorities they've set within state government to hire veterans first and do training and things. And so I just would like to make sure that as the workforce program gets going and the new funding which we've approved for veteran services more centered in Picken County, those two really work synergistically together to make sure we're connecting those people with the programs available.
Fantastic. And I just wrote a note to myself to add veteran services to our Board of Social Services memo. so we
In the
can
future.
keep you
That's
updated
great.
on what we're doing.
Super.
Yeah,
Thank you very
thank
much.
you.
Is there any, I had earmarked that TANF being at 54%. Is there any danger to us of running out of TANF funds, or can we shift other funds, or do we run out at the end of the year or over budget on that? Do we get leftover funds from other parts of the state? How is that
All of
handled?
that, there are several different options. One is that we have some reserves, not a lot, but somewhere around 50,000, and we're allowed up to 100,000 in Colorado Works TANF reserves. We get closed out, so there's the whole process. And I think ultimately, oh no, childcare and child welfare. You know, we haven't been overspent in TANF, so we kind of have to see how a couple of years go. But likely we would be closed out. That's our anticipation.
Mhm.
Meaning that the state would pay our overages from counties that are underspent.
Okay.
Okay.
And from the county budget perspective, it's a relatively small percentage of our human services budget.
Mhm.
So a little bit of over expenditure in this area.
Can be covered by other areas.
Yeah.
Uh-huh.
And we did hear that our CCAP overages were covered through mitigation and closeout, and that was somewhere around 53,000. So it's nice every year to start with a zero balance again, and
Mhm.
we've been very lucky.
Mhm.
Yeah.
Well, I guess in a sense, you know, I'm glad that people are able to make use of that program.
Yeah.
It's also too bad that people are in a position that they need to take advantage of the program, but I'm really glad that we have it there for those who need it.
Exactly.
Yeah.
Exactly. So,
We
do
need
you
to-
want to take a motion
Yeah,
for
let's-
both
let's-
at once or just one at a time?
Well, we could
Up to
do
you.
it right now. I'd entertain
Okay.
a motion to approve the expenditures.
I would make that motion.
I'll
Okay.
second.
Second. Any further discussion or questions? All in favor, say aye.
Aye.
Okay, thanks,
All
Connie.
in favor?
Next, in November, we'll bring June. We just weren't able to close it out fast enough this
Thanks,
time.
Connie.
Thank you.
Great. So then Kathy Lyons is usually here to talk about our client payrolls, which are our expenditures, and Mitzi's going to do that for Kathy.
Yeah, thank you very much. And so it was already touched on that what's most remarkable, I think, this second quarter is the jump that we do see in Colorado Works. So the TANF program with 8 clients is really more robust than it's been in the past, and I concur. It's really heartening to see the work of this program because it actually is getting folks what they need to work, to get back in the workforce, and supports and resources for their families. And Eagle County is just doing a tremendous job in that program. Otherwise, I would say that in general, what you're looking at is the comparison from this second quarter, 2013, 2014, and in most of the programs, as you can see, we're pretty much on track. There's nothing very remarkable in this quarter.
Except for childcare.
Childcare.
Where's
Yeah.
childcare?
Yeah.
Oh, there it is, yes. Except for
Right.
childcare, that's another
Right,
great
and
overage, and we have
um,
been,
We currently have 15 families being served, and a year ago, we were at
Right.
about 7. So Lihia, who you met before, is doing a fantastic job, not only in Pitkin, but as you all know, she has expanded to Garfield County and is now enrolling Garfield County people in their CCAP
Right.
program.
which,
Part-time here, so she's expanded her part-time here,
She's
part-time
She's
there.
expanded.
gone from part-time to full-time, and
Right.
20 of those hours are spent in Garfield County.
and they have been very pleased to have her because
She's great.
being bilingual, it's really assisted a lot of their team members as well. So as we reported, we've already been closed out for the childcare
Right.
and paid back for that increase. So it is positive. It's been a trend that's been going. In Medicaid expansion.
Hold on, they have to take a vote on this.
Oh, also
Um,
vote, and any questions too, and additional questions
So are we
about our
voting to approve the
programs.
quarterly program payrolls? Is that-
Yes.
The
I'll make-
payrolls,
We
yeah.
have to do that
Make
too.
a motion to approve the quarterly program payroll.
Second.
Second, is there any further discussion or questions? Rachel?
Well, I would just point out that although we are over, it is the closeout that generally makes it back up, and we'll hope that's the case this year. But at the state level, at the bigger level, you know, the HHS discussion is always, we need to make sure these funds are spent so that the state doesn't cut back the allotment next year.
Right.
So everyone's pretty comfortable with this arrangement going forward, making sure it's used.
Right, and just a reminder that these are payrolls, so these are direct services to people who are eligible versus our overspentedness on the operations, yeah. No, but I'm glad you brought it up because they are separate. We get, where we're overspent is in our operations, what it costs to make these benefits available. These are pretty much pass-through dollars, so we don't have to worry about these going up. Where we have to worry is in our operations. And so, but
That support
but
these.
as to make sure that everything is transparent and there's nothing weird going on with the payrolls, you all are responsible to approve the payrolls.
Okay, any further questions? All in favor of the motion, say aye.
Aye.
Aye? Okay.
Great, thank you.
All in favor?
Thank you. So next up is just a report on expansion with Medicaid. And as you can see, this chart compares caseload and covered individuals between 13 and 15 once again. And as you can see, we continue to increase service, or folks are being approved for Medicaid and enrolling in that program, continuing to increase for Pickens County. So we now have 1,051 adults and 462 children aged 20 and under, as well as 115 children covered by the CHIP Plus program, CHP Plus.
So you all asked for regular updates on Medicaid expansion, so this is primarily an FYI in case, unless you have specific questions.
I have a question. Is a lot of this increase due to the Healthcare Act and the fact that people now have to go through that process
Yes.
in order to qualify for Colorado covers? Okay.
Right.
Entirely related to.
Because, you know, having had to do that myself, go through the Medicaid process.
Application.
Yeah, once you're into that process, you might, if you don't qualify, one thing, but if you do qualify, you might as well take it, you know, get the
Right.
benefit, because it's a lot of work.
Well, and I think what's interesting is that I think many people may have gone to the ACA, you know, insurance website to find out and thinking, I'm going to find a company that I can be insured with, discovering that they're eligible for Medicaid. They never would have thought to apply for Medicaid
No,
if it had not been for that.
And
So
they never thought that they could afford health care insurance, so now I'm getting people that couldn't afford health care insurance that are getting health care.
so it's
This
a
is-
win-win, really.
Yeah.
In light of your Board of Health discussions, these numbers become more and more
Important, yes.
relevant because we don't have physicians in Pitkin generally who take Medicaid, which means 1,500 of our residents have to go outside of the county for medical care unless they go to the ER, which is fantastic. Or they go to Mountain Family Health, which is in Eagle County, and Dr. Kotz takes a big chunk of these lives as well, but he can't manage all of it. So
And it's just interesting that 2 years could see a jump like this.
Yeah, yeah.
Rachel?
It is a good number to have for that conversation.
Yeah, I think just to clarify what Patty was saying, that when a citizen goes through open enrollment through the Colorado website to search for insurance policies to buy themselves, that in order to find out if they are eligible for a federal subsidy of some of that monthly premium, they have to either qualify or not qualify for Medicaid, and then find out if they get subsidies for a private policy.
Correct.
So that's,
Exactly.
that's kind of the linkage where they all roll together.
exactly.
In my case, when I queued into the system for Medicaid for benefits, I got popped back into a different system because it said I was already claiming benefits, which was not correct. and the state had no way of correcting that through the computer system. It said I was getting food stamps. I've never received food stamps. So it was very interesting, and they didn't know why, so it became an issue of identity theft. So there was a lot of learning process. It turned out they still don't know what happened, and I could not do the application online. I had to come in and do it in person,
Right.
because the system didn't know how to correct an error.
An error.
So talk about learning a lot about this system.
And the state cut back on their funding for our Connect for Health program, but we still have a Connect for Health person available on a limited basis, and open enrollment will happen again in October, November, December. And we'll see if this jumps up again, and then hopefully the system will be easier and repaired, but
You know, you hope
We
they
don't know.
learn
It's always a
from.
work in progress.
it's a work in progress,
I see I was
exactly.
their glitch again,
Sorry you had to go through that, Patty.
And
Rachel?
one other follow-up question, again, this was suggested by someone we talked to after the veterans question was raised. Are veterans dual eligible? Are they eligible for Medicaid as well as VA? Because this gentleman was suggesting that it's often very difficult for people to get scheduled for the VA care that they are entitled to, and of course, not all service members are qualified for VA services, and to make sure that those who have the potential to sign up for Medicaid do.
That's a great question, and I don't know the answer to that right now, Rachel, but just to tag on to and what you mentioned earlier, there is going to be a regional training that I'm attending September 22nd. They're doing 2 from the Military and Veterans Affairs Division, one in Eagle the week before in September, and one on the 22nd. And so I will be,
Good question.
yes, it's a question I can
back.
pose, and I'm sure there's going to be a lot of resources and materials. Of course, I would hope to take our candidate. I'm not sure that the timing will work out that quickly for us, but because we want to recruit, of course, and hire the best person we can. But anyway, so thank you for asking that, and I will get back to you.
Okay, thank you.
Okay, great. I think I'm gonna skip over CCAP
Okay.
because we talked about it, and this is just a regular report that we give you around the CCAP expenditures, and we were bailed out, so all of that is good. So do you want to do an employment first update while
Yeah,
you're
it's
here?
not written in the, do we have that in the middle? Right there. Oh, there we are, one little paragraph. So I will talk about employment first. Again, as you all know, Colorado as a state has been under a federal waiver for this welfare to work essentially program for several years. And that has meant that we have not had to essentially require work functions for folks who are applying for subsidies for food assistance, and that has now changed. There were a number, I believe 9 counties that were exempted from this waiver in our Northwest region.
Right here.
And now, I think all except for us, except, is that true? Or do we have any other small counties that are in the 9 that were exempted? But Pitkin County, because of our contiguous location with Gunnison, we have been actually exempted again for 1 more year, which I'm sure will be reviewed. But since we, of course, work so closely with Eagle and have our IGA with Eagle for all of our services for SNAP and for our other subsidies, we are participating as much as we can with this build-up, if you will, back into the requirements of this program. And there's going to be a state-led 4-day training, thank goodness, the first week of September. That is going to really help Eagle County and all the other counties as well. We've been negotiating, you mentioned Colorado Workforce, and actually we're really hoping that we can see more of a relationship that we can build with them through the development of this program. And they've been terrific in coming to the counties who have this requirement now and offering their help. Eagle has been in the process actively for the last 6 weeks in trying to find locations that would be work fair sites. Essentially, that's where it would be like a Goodwill or Salvation Army, where folks could be sent and could work the hours required for their subsidy, and that could be counted as a work experience. The program is very complicated. The funding mechanisms are complicated. Eagle is anticipating that they need to hire at least one FTE to be able to work this program, but probably more. So the Gear Up for Employment First is very much in development stages right now. And we're really hoping that September is going to be, when we have the training again with the state, very focused with all the counties there, that we'll be able to start putting some MOUs in place. I know that Garfield County and Pick and Eagle, when we work with Rosemary Pettis, when we work with the Workforce Center, we're thinking that what would make a lot of sense is a hybrid program whereby they might help us with managing the work sites and the counties would manage the personnel sides of the program. There's a lot more to learn. So we'll come back with much more definite information.
I have a question though. How does that affect unemployment rates and job rates? I mean, how many jobs do we have in the county? What's our county unemployment rate? So if we're bringing in another factor there for people who aren't eligible for benefits, who are unemployed,
Right.
how are we going to have a fight for the job market since we only have X amount of jobs and we have X amount of people? How do we fit all those pegs in those holes?
That's a great question, Patty.
It's a good question we don't have an answer to.
Well,
'cause
that's,
we're still learning. We'll write it down.
You
No,
caused
it's
me to
true.
think that
Yeah.
question, so that's something we need to be looking at. I'm just thinking about all of these federal programs that are good, have good values behind
Yes.
them, that are coming online
Yes.
and unfunded in many cases, or partially funded.
Low funded.
Or the program is funded, but the ability to institute the program is not funded. How are then we as a county, like Eagle County, having to hire and fund an FTE to do a program that they're mandated to
Right.
do? I mean, that's a hit to the county's general
It
fund.
is. It is.
And when we have within the county hits to all of our departments for these new laws, new regulations that are to benefit the counties and the people of the county, how do we take that all into perspective across the board? That's the question I think we as the Board of Health, the Board of Social Services, and ultimately as the Board of County Commissioners have to look at.
It's no doubt. And the specific,
Overwhelming.
it is, the specific population that is targeted, of course, is the ABOD, as mentioned in the memo.
Yeah.
The able-bodied adults without dependents are the ones who are actually going to be required to participate, and if not, they will lose their benefits. And it's really, I think, from the Farm Bill, a federal push to limit, reduce the SNAP program, federal food assistance.
So on the good news side, Mitzi's working really hard on expanding the food pantry with Lift Up, and for us to have backup and backfill in the event that,
We don't
what
have
we
people
see is that our ABODs will step out of SNAP,
Yeah, and then
and
they'll
that
be
they'll
on the
need
streets.
food
hungry
subsidies
and
in other ways.
Right.
But we'll come back
We'll
with
come
that
back.
as we learn more, because
We're gonna have more.
we haven't had a robust work program here, and we really need one. So
Right,
we're
and-
looking forward to learning about that.
And Kathy Lyons and Eagle County have really, over the last couple of years, we have really attempted to become closer partners with the workforce staff in our region. We had a joint training about a year and a half ago. It was very successful. The follow-up and the ability to really see how the two entities are working together, how we can really improve the work experiences for folks in our programs, hasn't really gelled. It's just been really an uphill climb, and everyone will say that. I'm kind of hopeful that the crisis, if you will, of Employment First is actually going to get us over the hump of that, and that we will
our
develop
workforce.
much better workforce,
Right.
relationships and connections so that but you're right, Patty, it's almost like we need more jobs. We need a
how do we
sense of
fill in all
more
that without
employment
hitting the
possibilities.
people who aren't
in
on
county.
benefits, who are getting close to? Are we then throwing them into the benefit need and this vicious cycle?
Subsidy and,
Cascading effect.
So it's,
Rachel?
Yeah, no, this really presents some interesting dilemmas and possibilities, as you're
Duh.
both saying. And it sounds like this is coming down as a mandate federally as opposed to from the state. Because I know
Correct.
the governor had very strongly issued when he first got elected, we're not going to do unfunded mandates to cities and counties type of statement, but if it's coming down federally, it's a little bit different. I just am hopeful, and I think that this is kind of pointing in that direction of really having a sit down with the director of the Aspen Chamber Resort Association.
Yeah.
And perhaps at the same time with the snowmass as well. There are always the fall job fairs. And, you know, for the ski company and other employers.
Yeah.
And, you know, perhaps even just getting a better idea what skill sets would be needed, what type of jobs will be offered at that time, whether we should, quote, have a booth there or not, but how do we begin to connect to those jobs more readily? And you know, we can do some training with people to make them hireable. What would you like?
Workforce group
It's a
looks
great
at that.
idea, but in the Workforce Investment Act requires us to work locally with the integrated team. So when we will be moving in that direction.
Okay.
That will be an important part, obviously, our partners.
Okay.
So,
Thank you.
thank you. Thanks, Mitzi.
You're
I think,
welcome. So,
we'll
next?
just quickly, tomorrow you'll be hearing first reading on the CCAP Works Memorandum of Understanding. That's an annual thing you have to sign that says, and it's an intergovernmental agreement, so there are 2 readings, that says we will comply with their obligations if we want to provide those programs in our county. So you can anticipate that. And then we just did a quick update about the healthcare policy and financing incentives, that we received 100% of the incentives, which brings in a whopping $4,169 that can go to anything we want. It's not
Nan's pin
restricted.
money. It's her pin money.
So we're excited about that, and tomorrow you will see also a proclamation to support Child Support Enforcement Awareness Month. Child Support Awareness Month. So you'll see that tomorrow. And then, Kim, do you want to come up for CCR? We'll get to the really exciting part about CSTAT in a few minutes. We're almost there. We're almost there. So exciting.
Good afternoon. A few months ago, we presented a supplemental request to utilize some funds that we received from the state to do an assessment, a community-based assessment to determine what would be the best use of dollars for something called Colorado Community Response, CCR. And that assessment was completed. If you remember, CCR is basically services and supports to assist families who have been not accepted into the child welfare system, or they've been in our system, but they still need some additional support. So I kind of look at it as prevention and aftercare support. So that assessment was completed by July 1st or June 30th, and it was determined that the consensus was that we would have a school-based program with the Aspen School District, if that was possible. And so they agreed to that, and we received new funding July 1st. So we have to act as the fiscal agent for that, but we really want this to be a community-based program. So in that agreement, we will be presenting an intergovernmental agreement next week.
Tomorrow.
I was going to say,
Okay.
It happens that fast.
Oh my
It's
goodness,
amazing.
okay. My days are way off here, sorry.
It's okay.
Tomorrow.
We're with you.
Yes.
We'll be
And,
here.
yes,
We'll see you
and
tomorrow.
that is basically to talk about, or to legitimize, I guess, our relationship with the school district. They'll be hiring and managing that whole piece, but we'll be, like I said, the fiscal agent. We're all very excited about this. We met with them yesterday. They're making space for this. We just are really excited about this collaborative effort. So that will be happening tomorrow.
Great.
I don't know if you have any questions about
George?
that.
Yeah, do we have a relationship with RE1 school district at all?
We do have a strong relationship with RE1 and the Family Resource Center, which is doing this work for Garfield County.
Right.
So where are they located?
They're located in
Basalt
in Basalt,
School,
in the
the-
schools.
Yeah.
So they're doing this not only for Garfield County, but Pitkin and Eagle as well?
So Eagle got the grant for CCR, and part of their grant was that they would expand to Garfield and Pitkin in year 2. And so what you're seeing here is the expansion. And so what we decided was that we're going to focus on Aspen schools because they don't have a school resource center, they don't have any resources in the school, and Basalt is well supported through the Family Resource Center.
And just so you know, we're going to be working really closely with the Family Resource Center as we build this program here, because they have a lot of expertise and knowledge. And so it's still going to be a partnership, it's just that the school will be holding that IGA. So there's going to be a lot of cross-training and support.
Okay.
So this will be a program that within the school, so the school will send out information to the parents and say, this is a resource available to you so parents here don't feel like, oh God, everybody's going to know I'm on welfare. So it's just an assistance program to help parents and explain to them what's available to them in the community, just like we try to do, getting out the word about the food banks and all that. Okay.
And the linkages will be directly with this person that they hire, so it won't be like this is broadcast all over the place. We definitely want it to be a support and without people feeling exposed in any way.
Yeah, because we have such maybe a stigma, and maybe in the Aspen school districts more than others, with this level and this level of resources that the families have.
It's a really good question because we haven't talked to the school about a communication plan.
Yeah.
And it's a new partnership. So I think I wrote that down
Thank
to
you.
talk with them about
How
what their
we're gonna get the word
intention
out.
is and how we're gonna call it, because CCR doesn't mean anything to
Yeah,
anybody.
it sounds
like a-
Colorado Community
I know.
Response doesn't mean
It
anything.
sounds
There's
like
another
a-
acronym.
Sounds like a bike club or something.
Yeah. Okay, thank you. Oh.
Yeah, this does raise a question for me, and I don't mean to belabor it, but we're responsible as the fiscal agent and the fidelity and outcomes of the program, but we're not responsible for the hiring of the person and the training. And so it just seems like a little bit of a disconnect in a governance model. I mean, I'd be the first to agree. I think the school makes the appropriate home for it and perhaps the appropriate resources available. But at the same time, will we be sitting in on their hiring process? They've invited us to do that, help
Yes.
evaluate
Yes.
the candidates.
Yes.
And then the training, are we responsible for their training? How will we measure the outcomes? How will the school district measure the
Right,
outcomes?
right.
of
Well, that's
success?
a great question, and it maybe wasn't clear in there, but it's really a joint effort. We've already, for instance, one of their counselors and myself went to a joint training in July to understand how to implement this program and what the different data was that we had to collect and that sort of thing. The hiring is going to be joint. The management, actually, in terms of the outcomes, would be joint. I mean, that's really part of our role as well, because we are responsible. So,
And in the intergovernmental agreement, we outlined the expectations for the school district that are requirements of us by
Right.
the state. And just so you know, about half of the CCR sites in the state are outsourced, and half are managed in-house by counties. So we're not the first to let go a little bit of, and really work on trusting our partners to.
And again, maybe it's for a future time or background when our next intergovernmental agreement has to be more formally ratified. But I'd love to know what are the responsibilities of the Colorado Community Response Program, a little more in depth than what's described here. Because, it comes to mind for me, are they responsible for perhaps, say, training other mandatory reporters within the community? No,
Yeah.
they're not, but I didn't know that. So,
Right,
because
right.
I've heard that question raised a little bit in the context of all the various summer camps that we have and summer childcare. Have these folks, as counselors, been trained of what to spot when they have to mandatorily report or
I
not?
can include our contract with the state with the second reading.
Yes.
That might be helpful for you, because
Yes,
you can see
something
that
like
I've
that.
taken almost word for word the compliance obligations recommendations and put them in IGA.
Okay.
So
Yeah.
we'll review that.
Yeah, and so I just want to know where those separations are, and are any of those silos that are perhaps artificial or detrimental to the program, or how do we continue to unify all these efforts
Okay,
on
great.
the child safety?
Thanks.
Thank you.
Okay, so much going on. Okay, Marty, do you want to come up and talk a little bit, and then we'll do the fast drill on CSTEP.
Marty Ames, Pickens County Senior Services. First, I just want to express again the appreciation of our department and for Steve Child applying for and being appointed to the task force, the governor's task force, to take a look at this growth in the aging population and some potential ways to develop services that are a little behind. So thank you.
Yeah, and thank you. And there are only 2 West Slope people appointed to it, so
Great.
we want to work as a team as much as we can with, you know, different counties on the West Slope and our staff here to
Who was the other
do as
appointee?
much as we can for this, you know, the aging population as well as representing the West Slope.
Who was that other appointee?
Somebody from Grand Junction,
Oh.
man, I didn't recognize his name. One of you probably would recognize his name.
Grant Jackson?
Well, I don't
Maybe.
recall it right now.
Mhm,
I'd have to
probably.
look it up on my email.
I don't know.
And also, I serve as a Northwest representative on the Aging and Disabilities Resource Center Council with the Northwest COG. So slowly but surely, these orbits are gonna come together.
Someplace.
Someplace.
In the stratosphere. So the numbers-wise, nothing particularly remarkable or from the same quarter last year. Our congregate meals are a little up, the home-delivered meals are a little down, sort of the normal fluxes that happen just in a small community with a small number of people. There is an interesting, and I don't really have an explanation for it, in terms of the number of care management clients served compared to the hours. And yet, I'm sorry, I don't really have any concrete response. I think it really has to do with how we count the caseload. As you can see, it says the number of individuals served in 3 months may have duplications. So we look at each month, that caseload, and add those together. So in all likelihood, what this represents is clients receiving a large number of hours and then being able to be taken off the caseload for the next month. So, but anyway, as you can see, the number of hours is increasing with the complexity of some of the cases. As I mentioned last quarter, and I did want to follow up on this just briefly, the decision was made by the Area Agency on Aging under the Northwest COG to delay, to extend our current funding contracts for our federal title monies and state older Coloradans monies through this year for 6 months to the end of December. Those decisions, however, the citizen or the committee that is making the decisions on the next funding cycle has been meeting, and those decisions have not yet been finalized. They said they thought they would be finalized in September, and I'm anxiously awaiting their decisions since we asked for a couple of things a little differently with our partners in human services, trying to shift the care navigation program a little and some of those things. But hopefully by next quarter, I'll have the answers, and you'll have already seen them in the budget. The other things that I mentioned in the report are the nutrition program, as you know, and I know you expressed some concern about our 2-week closure of the kitchen in July. And I think that turned out to be a wonderful opportunity to do a lot of work that needed to be done. For me personally, to become familiar intimately with the expenditures and the inventory and, all of the processes around our nutrition program that, I could kind of get away from when I had a competent person in there. So it's wound up, we've wound up with an excellent new kitchen manager, chef, Julie Bloomingdale, and our assistant is Luciano Rodello. So he is, who is really hard worker and very pleasant to be around as well. And the meals have been great. So hopefully that little hiatus didn't hurt anyone too much. They certainly are back in droves and appreciating everything.
Well, I'll just put in a good word here, too. If anybody has the opportunity to go out for a meal, Julie is an excellent cook. I've known her for years, and she does a great job. And she is very excited about being up here.
That's nice.
Yes,
So
she is.
is Julie doing the double duty going down on Tuesday and Thursdays to Eagle at Elgin at this point in time still, or?
Yes, of course, with our partners in Eagle, we wanted to be as flexible and accommodating as possible, all of us, and Julie leading that. I believe that the last thing Julie told me is that this week is the last week has to double up. She's been with us for she's been 3-4 weeks with that transition, but that's, I think, been very helpful for Eagle and the Elgin site.
Mm-hmm.
So nice smooth transition there, I hope, for them as well.
She's working on it. I talked to her yesterday. And she's working on it. It'll be there soon.
She is. And the other highlights, are the other things in my report were just sort of a quick department update and the update on the strategic well activities that are going on, and unless you have any questions.
When's the golf tournament?
October.
It's in October.
Well, it's not really a senior golf tournament. This is for the second year. We are with the Mayor's Cup, kind of.
Partner.
Yes, partnering with the city. And so it's a joint golf tournament, I guess you would say. Kent Bigelow and Chip Freeman are representing the senior council, or have been asked by the senior council with their support to be the front men and organizers for our end of the golf tournament. And they've been out raising some money and working with Steve Aitken and others at the city to try to get a good representation of seniors. October is kind of on the late side. It'll be definitely a locals group, and we encourage anyone over the age of 50. I think they dropped it to 50 for the golf tournament to participate. It'll be a lot of fun.
Great, thank you.
Mm-hmm.
Thank you.
Any other
Thanks,
questions?
Marty. Okay, so here's the quick and dirty on CSTAT. You have started getting monthly reports that look like this. I've been getting these reports for 1.5 years. And basically, the Reggie Bika and the state of Colorado brought in some changes, which really is about performance-based analysis and really using numbers to manage how we're doing. The state of Colorado measures 133 different outcomes. There are only 19 that we are responsible for. The other, however many, are managed by the Department of Behavioral Health, Juvenile Justice, all of the departments of the Colorado Department of Human Services. And so I get these reports every month. I send them to our Eagle County partners for economic security to look at and explain numbers to me. I send them to Garfield County. I send them to my entire team. And we are constantly looking at the numbers that are coming up monthly and also looking at the numbers that come up annually. As small counties, so there's in your packet, you have these. I didn't put the whole July report because these are big, but I actually just want to refer to this report first. If you forget what these things mean, this report is your best guide. And right. So Basically, what you're looking at is they're taking our total caseload for any of these measures. They're seeing how many of those cases did we meet the compliance goal, and then they're telling us about that. And what's really cool about this report, the book report, is if you look at the first measure right here, timeliness of new adult financial applications. This page explains to you why does this measure matter. Because processing new applications efficiently ensures eligible Coloradans have what they need. And then it says how it's measured, and it tells you what the numerator and the denominator are. And it also compares us, so the dark black line is our score, and the lighter gray line is all the other 44 smallest counties in Colorado and how they scored during the month. And so what you will see, I'm very proud to say, is that Pekin County scores a lot better than most of the small counties in almost every measure. But in some not, and you can, in particular, you might see in a particular month we might drop because of one case or data entry. These are, luckily for us, because we're small, we can drill down and say, whoa, what happened there? And correct it, and then move back up. Kim and I went to the state of Colorado CSTAT office last Tuesday and met with them. And we reviewed our findings with them. They were very positive with us and said in the past year, so in the report that you get, which is called a dashboard, Pekin County shows improvement in 15 of the 19 measures. And if you look at the balance of state report, the 44 counties only show improvement in 9 or 10. So what the state is looking for is improvement. They're looking to see if we met the goal, which you'll see in this column right here. And then they're also looking for the trend upward or downward throughout the months. So in particular, you know, this is, okay, so this is really a good one of my, I haven't talked to you about. This is accurate child care reimbursement. So what it means is that that our local child care providers are getting reimbursed through for CCAP through the financial machine called a POS. We have one provider who consistently is not doing this correctly and who has to do what they call manual billing. So this red score is one provider who constantly is knocking us out. Leah goes to that provider every week and works with them, and we're just having trouble helping them be successful. Everyone else is successful. So you can see that, you know, one case, one center, one client, one late assessment can knock us out and put us in the red. So the four things that we ask you guys to consider looking at are the numbers. So, you know, keep in mind that our N, we call them the N's, the numbers of cases or counting, they're pretty low because we're a small county. You want to look for the trends of looking hopefully for more green or movement toward green. Now that we have 15, you know, we've seen improvement in 15 of the 19. It's going to be interesting to see if we hold it there or, we'll, you know, what happens. I don't know.
Man, I can't, I'm trying to correlate the 15 out of 19 to the red and green, and I can't.
Well, so
figure it
you're
out.
not going to see
So maybe it's not
all
the red and
15
green.
here. It's just improvement in 15 of the 19. So it won't show up in this final column necessarily,
Okay.
although
So you'd
I
have
think
to,
there's
you
like
get
10
it
or...
from the chart going
Yes,
across.
yes,
Okay.
reading across. And really interesting is to really compare it to the balance of state, the other 44. And I gave you that, but I don't want to confuse everybody. It's really red. This is the this is the 44 balance of state. So small counties have trouble with these measures. And The state tries to help us with improvement. We're so lucky because we have Garfield and Pitkin primarily doing our child support enforcement and economic sustainability, and they are big departments. So they've seen a lot of success. They really work on improving these measures all the time. Try to look at how many months we met the goal. Really the point is, we don't get too wigged out when we don't meet a goal or if it drops a little, especially if we're looking at the N. So if you look at APS timeliness of initial assessment or investigation, where we have seen a trend of improvement here, we still are below the mark, and it is related to one case. And it might be data entry and not related to, it's likely, because we know this one case, not related to the client getting the service.
So, I have a question.
Yep.
On page 47, under Children in Congregate Care, Child Welfare Division, both on that page and on the dashboard, since November of 2014 to current, we're at 0. Does that mean we had no children in there to report? That's why we look so good? Oh, perfect.
Correct.
I'm going, why are we 0? Why are we?
Yeah.
Oh, because we probably didn't have a child that fit into this category.
This category.
So that's what, and then before that, we were in the red, but now we're in the green because all of our children are, right?
Yes, that is correct. So as a small, let's see, you're talking about the measure, one of these measures.
Yeah, exactly.
Right, we have our number is 0. So, and you'll see that we're in the red there because we have one child that's an outlier. And
For those first 4 months.
yes, exactly. No, right.
Oh, right there. What is an outlier? Define that.
Meaning that we have a child that is moving towards adoption, and we haven't completed the adoption yet.
Right.
So it's such small numbers that you're going to see things, and like we know as a small county who these people are. And some of the things we can't change. We can't make it go faster.
In the first 4 months, you had a 2/3, so you had 3 children in the program and 2 were...
No, so the bottom number is the out-of-home placement total.
Okay, 3.
And then the top number is the ones that are the kids that were in congregate care. So it's that percentage, 2 of
3. It's 2 of 3.
2 of 3.
1 of 2, 1 of 2.
Now we have one child in out-of-home placement who is not in congregate care, who's in foster care, and who will be adopted in the next month.
Great.
I know it's kind of
Yeah, that
confusing when I
helps
look
me
at that,
understand
like-
those numbers, and also helps me
Right.
understand those numbers in other pages.
Right. And the congregate care is what I've talked about before. It's like more residential placement, Department of Youth Corrections, those kinds of
Facilities.
Yeah, and we want to definitely move the needle on that.
So every measure has a different numerator and denominator, and that's why this report is helpful. If you get concerned about something or whatever, you can contact us and we can explain it. It gives you the Pickens County's numbers and then all of the state's numbers, the balance of state numbers. And I guess the question for you guys, because we had to go over this fast to make room for Liz at 2 o'clock, is to think about how you'd like us to review CSTAT. Every county is different. We kind of look at it as an annual learning because the trends take about a year or even longer to see if we have any trends. But you're going to be getting this monthly, and so just want to open it up to however way you all would like to review these numbers.
When do we usually get it? Because I didn't see any in mine. We usually get it by email.
It's coming from CCI, I think, by email. Is that right?
I haven't.
No, I don't think it was through CCI.
It's from the state.
I haven't seen one in a while come through.
Yeah.
It's coming from CDHS.
Do we know what time of what part of the month we might get it? Because I just pulled my email. That's why I was playing with my email.
I can find out. I don't know.
Figure it out, George.
Well, I think for me, I'd be just curious about, sort of like when you look at budgets, just where the variances, the large variances, either positive or negative. What are we really doing well, and then where do we need some more help? instead of just the whole list. I mean, that would help me just to get a sense in terms of what's happening in the community.
Okay. On an annual basis, kind of like annually with the budget, maybe?
Yeah, once a year.
Okay.
I wasn't thinking once a year, but I was liking your general trend.
Yeah.
I mean, I think that perhaps highlighting one or two of these programs each time.
Oh, okay.
To say that this is how we go after this one, this is, you know, how much improvement we've had, or this is where we really need to improve. And maybe go over one or two of the stats at each meeting, you know, whatever seems to be most relevant to some of the work you're doing or programs you've been initiating or things like that.
Sure.
I kind of have to say for myself, and I wonder what your impression is, that I'm not so sure this information is all that useful, because of the, you know, maybe just the color coding, it's red and it's green, you know, it's kind of like
Christmas.
Stop and go, you know, and the red, of course, you know, is like a danger alert, you know, and so it doesn't really track, you know, yellow, you know, somewhere slow down or, you know, speed up, or you are improving. It's just, you know, I kind of wonder what type of money we're spending on the stats. Were these stats necessary for federal compliance and reporting?
Good question.
I don't think so, no. But there are statistics that we are responsible for. In child welfare, it's called the CAFR, and I don't even know what child and family something. So there's a whole nother set of measures that we're measured against. And then there's measures for incentives. So we're measured all over the place. We do pay a lot of attention to the incentives because there's money attached. And these we pay attention to, and we want to perform and comply because they're important.
Sure.
But we don't get wigged out if we don't.
Well, I can't recall exactly what it was, but there was some sort of threshold that if the state as a whole fell
Yes.
behind,
Right.
then there are penalties,
Yes.
and the state doesn't receive the money that we need to actually maintain these programs, which is.
So timeliness of food assistance applications, those are federally driven, I guess, yeah.
And so I guess, it's, you know, highlighting some of those
Okay.
would be important, that we are showing that we're doing what's necessary to not be part of the problem. to
Yes.
may improve penalties.
The compliance.
Okay. We'll try some monthly or quarterly, because we come quarterly. Updates, maybe choose about 4 to highlight and let you know how we're doing. And focus on the federal requirements and the incentives, which has dollars attached. Okay? Thank you.
Thank
Okay,
you.
thanks very much, Nan. I'll accept the motion to go out of social service, Board of Social Services.
So moved.
Second.
All in favor, say aye.
Aye.
Aye. Okay, and we are still in special session for our next, which is coming into as the Board of Health. So I need a motion to go into session as the Board of Health.
So moved.
Second.
All in favor, say aye.
Aye.
I'll be back in just 1 second.
Okay, and welcome, Ann, to join us.
Hi, Ann. Good timing.
It was perfect timing because we were running several minutes behind, and that was perfect.
The storm is moving in.
Really?
The storm?
Yeah, no, I'm
You ran ahead of the storm.
sitting here somewhere.
Good thing I brought my raincoat, maybe.
I tried to bring the beautiful weather from Southern California back with me, but it kind of stopped right about the Colorado border.
There we go. Okay. Good, I'm just gonna start up front and then I'm gonna move back and you can move up or.
Oh, do whatever. Is this okay here?
John, the arrow. We we will learn this, Liz and I. We need to commit.
Had some very interesting letters while I was gone. Just having a chance to read some of them. Hit the window. No.
I have not heard from her. I
There
planned.
you go.
She did respond that she was coming, so I assume
Who are
she's.
you expecting?
Marky, still.
Okay, well,
Yesterday I heard that she
we
plans
thought
to
she
be
was
here.
coming last time too, and then she
I know.
didn't make it. So I think we better start, and
Okay,
we'll catch her up if we have to.
okay. So you've already convened as the Board of
We've
Health?
convened,
Okay.
yes.
All right, thank you for waiting. I'm Liz Stark, Picken County Public Health Director, Executive Director of Community Health Services, and we're at our third quarterly Board of Health meeting for the year. And I'm going to sort of let Nan start to introduce her item summary with some thoughts about we're doing our budget presentation today, and so I wanted Nan to sort of introduce the topic from the staff perspective.
Thanks, Liz. We decided a couple of years ago that Community Health Services would submit their budget to the Board of Health in August so that there is some county commitment to the funding for public health, because it's such a large amount of money and it's too difficult for the Citizen Grant Review Committee to decide whether to fund or not to fund public health at this level. So what we do is present, you all make a recommendation. Of course, it's complicated because you're the Board of Health, and you make a recommendation really to the Board of County Commissioners, who would adopt the budget in December. So this is the beginning of that process. And we find that it's really helpful for you all to decide how you want to recommend funding for public health, because it just makes everything so much easier with the Healthy Community Fund, which is the sole source of where the funding for community health comes in Picken County. So Liz is going to present to you her budget. She's presented this to the Board of Community Health Services as well. Her request from the Healthy Community Fund is for $454,000 in 2016. So she's coming out of, Community Health is coming out of a 3-year partnership, and they were held at $320 for 3 years. And so they're coming in with this request. Staff, which includes me and John Redmond, Connie Garofalo, and Mitzi, have been working with Community Health Services because of our concern that 454 is a big jump and that the Healthy Community Fund can't absorb that kind of growth. We're recommending three things. One is that we take community health services out of the grant cycle, that they don't actually have to do a grant and also come in here and present their budget. It's kind of crazy making for community health, and they are providing our public health services. So we want to simplify for them and take them out of the process, which would mean that they'd come in through the county annual budget process. The second thing is that staff is recommending that we recommend increasing their funding from the Healthy Community Fund to $358,000, and I see that in my memo I transposed numbers here. So that $358,000 is an increase from $320,000, and it involves $15,250, which is the general and administrative expenses, half of it, and $23,000, which is half of the loss in state and local funding. So you'll see in the memo that I mixed those numbers up backwards. Recommending that community health services consider meeting the other half of that growth costs, those increased costs, either through their general reserves or in some other way through efficiencies. Liz and I have spent time talking. We think for sure that they need help with emergency preparedness planning and with the planning and partnerships, but we think that they don't really need the planning until 2017, and the EPR position is funded through another source through, I think, the fall of next year. So our recommendation is to do this funding for a year, and then it leads us to the third part, which Liz and I are both in support of, which is to have the county fund a consultant who can look at the way that we structure public health and governance and funding and our direct services and our planning services in public health, and just make recommendations about how we want to do this moving into the future, so we don't have to always look at the direct services they provide, the prevention services that are provided, where do we want to spend our money, really have sort of like a vision for the future that would help us move forward with that. So those are our recommendations. The last would come from the general fund.
George?
So how would that be different, or would it not be different, how we're approaching senior services funding? So senior service funding gets 21%
Right.
of the budget comes from, or 21% of the Healthy Community Fund goes towards senior services. So you're looking at doing a similar
Something
structure,
similar for public
and then
health.
what sort of percentage then are we looking at coming from Healthy Community Fund for
Right.
community health?
So that would be determined with the work of a consultant in the next year, whether it's a certain percentage that comes out of the fund or it's something else. But that is yet to be determined. But that is the concept, that instead of thinking about it every year, community health services would know what services Pickens County wants to buy, and we would be responsible for that through either a percentage of the fund or just an allocation off the top in August before we go to the grant review committee.
So what percentage currently comes from the Healthy Community Fund for community health services? Do we know? We don't know.
Well, the fund is $2 million.
The fund is about $2 million. We haven't yet heard what it will be for 2016. So we can get back to you on that.
So
We're for the last 3-year partnership, we've been at 320,000.
somewhere around
Whatever that-
30,
15%. sounds like to me at 2 million.
I think it's less than what the 320 is less than senior services. The 458 is significantly more than senior services. So it's somewhere.
Patty?
I would like to, I understand the need for a consultant because we can't, it's beyond what our capacity is within house. Part of that, though, I would like to have a better understanding of what other small counties and large counties do in the state, how they fund and what percentages come from where, and in light of services. And I'm sure you can understand this, as a member of the board, not of the Board of Health, but of the Board of County Commissioners, we keep getting caught in these roles here. We have to look at the general fund for all services the county provides across the board, all departments, all needs, all the new laws and requirements that we're all seeing, emergency management, public safety, I mean, all elections, you know, all those things that we're seeing across the board. So I think you can understand that we as the Board of Commissioners has to be very careful in using where our general fund monies go, so we look at things evenly as best possible. Even though, you know, we have to give merit to all the different services and where they fall in line with what our goals and plans and you know, truly public safety, public health. So I think that's important, and I think that needs to be brought into the picture looking at the consultant.
Will do. Thank you.
Yeah.
And I know
It's important to I think, to me.
Right. Comparisons. Liz has done a little bit. I've done a little bit, but we really both believe that it would be helpful to have someone that, it doesn't work for the county, it doesn't work for community health, can look at it neutrally and make a suggestion about the best possible next
what
steps.
What do comparable county sizes do?
Right.
And, you know, how do we, even though we are comparable in some ways and we're not comparable in others, and even in small counties.
Right, exactly. And I know, Liz.
Just one other quick question. In the community, sort of like senior services, but the community fund has currently had a 3-year partnership.
Yeah.
So is that partnership ending now? So that's why you want to go into a consultant phase rather than trying to restart that partnership for another 3 years while having this information?
Well, this is staff recommendation. So Liz is doing her best to keep up with it all. This is because we run the Healthy Community Fund and we're a Health and Human Services Department. So yes, she's ending a 3-year partnership, as are almost 70% of our partners. So we're getting increased requests from all over the place, including public health, which is critical. And we want to look at how do we take community health services out of this cycle of having to compete with these other services when they're providing a mandated service. Yeah.
So if I could just add that we have submitted our Healthy Community Fund grant application, as all the other nonprofits have, and we have the opportunity, unlike all the other nonprofits, to come before you to explain our budget and the rationale for our funding. But our grant application will go in front of the Citizen Grant Review Committee in September, as all the others will. And so this discussion, usually, and even in past years, has sort of tried to preempt that review by the Citizen Grant Review Committee and take some of the load off of them to determine what our funding source should be, because we are public health, we have mandated services, and it's up to the Board of Health to determine our level of funding. So we went through the motions to submit a new grant application because our 3-year partnership was ended. And in reviewing the amount of money that we were requesting, Nan and I had to come to some kind of compromise, if you will, about how to move forward considering the limitations of the Healthy Community Fund.
So Liz has a very thoughtful and thorough explanation of her costs and why the costs are higher, and we thought that it would be best to just sort of start with where county staff is recommending, and then move into the Director of Public Health's presentation on the needs, and then come back to how you all think we should proceed.
Rachel, did you have a question?
Yeah, I am kind of confused by the sequence because we were having a lot of questions there about it so far. And I guess, similar to Patty's comment of supporting a consultant or planner to look at this, I see the value of that. I want to make sure that the look is comprehensive enough. I think it really should be open in terms of the outcomes, so that, it's not how we could do what we're doing better, but how we can do better. And whether this governance structure, which has evolved over time, is the right method, as well as what a percentage of healthy community fund should be or not. I think and this work would be especially important knowing there is an upcoming renewal of the Healthy Community Fund. I'm not sure if that's 2018, something like that. And so that may help guide both our potential ask and what our structure is. So we should have a hot eye to that. It's not very far away. And this report might very well be a part of it. The other question which would be important going forward is to really examine the ballot language, because I know the original ballot language, I believe, suggested what would be reviewed by the Healthy Community Fund Advisory Board and what would not. And, whether a percentage was set aside for senior services, what amount that was, versus trying to move this into that category. And so we really need to check for coherence and conformity with that, the ballot language. And then maybe you'll get into this in your presentation, so I don't want to jump too far ahead, but it seemed that community health services seems to still see a lot of uninsured folks. And it would seem to me that perhaps can we make a requirement that you get signed up for Medicaid and you at least have some insurance? Maybe not on your first visit and you're treated well, but part of the condition of the treated well and the subsidy for that is that you sign up for Medicaid now, or you go through that process. And, we shouldn't be at 70% uninsured when we have these new programs going. And that's not your fault. It's just, everyone's catching up with what Affordable Care Act did. But it seems that, generating what revenue is available for that for some reimbursement of services is something that we just need to be on. And that, I'd imagine that's going to be one of the first recommendations from the consultant. But, how do we go about that? How do we integrate human services and with your health services for that outcome? And then the last question was, it does reference Title X funding and family planning. And I was under the impression that the Planned Parenthood office in Glenwood Springs also provided some of those services. It was available for Title X, but you can go into that when you get there. I don't know. Okay.
All right.
Thank you.
Happy to.
I have a question for you, Liz. What percentage of your uninsured are undocumented?
That's a difficult question to answer because we don't screen. We don't ask that question. But I would say, and as I've sort of mentioned in my memo, it depends on the program. So it's largely in our women's health program. I would say 50%.
Okay. And the question back to Rachel in terms of Medicaid sign-on, are you finding what people are saying to you that they can't even afford the health plans under the Affordable Care Act? That's what we're finding.
We're hearing that. And some people just are refusing to get insured yet. They're just not doing it.
Yeah, they're totally against it.
That too.
Government might be on to them.
Yeah, let alone they want to access subsidized services at the same time.
Right. It's a real challenge and dilemma.
It is.
Okay, I will get started then.
I have one other question for you, Liz. The Public Health Association meeting, is that in September?
Yes.
Okay. I think that might be very valuable to learn at that.
What others are,
Huh?
what others are doing or not doing.
I'd really like to really participate in that because I
Great.
think there's a lot of opportunities to learn there.
It's Public Health in the Rockies.
Okay.
Is the Colorado Public Health Conference. It's being held in Vail in September. So I'd be happy to share that information.
That'd be great.
with you.
Yeah, let us know.
Yeah.
Do you want to introduce your team up here? Or do you want?
They're happy to sit with me. Let's see here. Let me get technical set up here. Okay. So what we're going to do today is review the events from the last few years that have really changed the organization, look at some future trends and the proposed financial needs of community health services. the last 3 years have, in many ways, have changed the whole face of what we do here. And I'm just going to briefly mention some of the largest impacts on the organization. First of all, in 2012, you may recall that the CDC issued new guidance about publicly funded vaccine could no longer be used routinely to immunize people who were fully insured, and that was just in an effort to preserve those public dollars for the people who were uninsured. So that new mandate from CDC forced us, what we learned during that process is we were serving a large amount of insured people in Pickens County who had in our immunization program particularly. So in order to continue to provide that service, we felt compelled to get into the insurance business, and we got all of our insurance contracts and we started billing insurance for both our immunization and our family planning services. So that was, as you remember, that was a huge change for the organization and for public health in general to start getting into that business. We had to purchase an electronic health record and an electronic practice management system, and we had to hire staff in order to do that billing. So that was a financial and a big systems change for us. In 2013, of course, the Affordable Care Act was implemented with Colorado Medicaid expansion. And again, we started seeing more and more insured clients. At the same time, continuing to have all these public funds for the uninsured. So what it did for us was created sort of a new layer for us to be very careful, sort of back to that immunization issue, of being very careful that we are assessing each client for which funds that they are eligible for. So we couldn't just give all our publicly funded services to everybody. We have to really screen people now about whether you have insurance and what your benefits are. Could you be eligible for these publicly funded services under this scenario or this scenario? So that really added another level of care coordination and patient management for our staff. And then, of course, the Public Health Improvement Plan. As you remember, the Public Health Act of 2008 mandated that every public health agency perform a community health assessment every 5 years and submit a public health improvement plan. So Community Health Services did that community health assessment in 2012, and we hired a public health planner to perform that function. And so that has that was adding a lot of population health work to the organization, when traditionally we had been performing those direct clinical nursing services. So that sort of changed the focus and the scope of the work that we were performing. So that created a big impact. And then, of course, in 2017, 5 years will have passed, and we will be expected to perform another community health assessment and update our public health improvement plan. And then, of course, Ebola came along in 2014, and that impacted our organization in a huge way. Every public health agency in the country was responsible in leading communities in how communities as a whole could respond to the unlikely event that someone came to our community with Ebola or with an exposure to Ebola. And so it really heightened every medical and public health organization in the country to look at international global outbreaks and public health response. So in response to that, the Colorado Department of Public Health applied and received a grant, applied for and received a grant from the CDC that then is passed on down to local public health agencies and to help locals continue this preparedness work. It's the plan, so this grant started July 1st of 2015 and goes through September 16th of 2016. The idea is to work with your community partners, which in our case will be Aspen Valley Hospital, Aspen Ambulance Services, our medical community, to develop plans for response to Ebola specifically, but of course the concept is these will help us in any type of global outbreak.
Can I ask a question on that? Which I forgot to mention before, but I was curious when I read the memo. How much does that differ from the type of response plan we had developed for the potential of highly contagious bird flu?
Well, it's pretty much the same thing, only it's just the new disease du jour, but there's more focus on public health, I think, being the lead in those agencies. As you know, Community Health Services is the ESF8 lead, Emergency Support Function lead for Pickens County, and Public Health is the lead at the state level. So there's just been a lot of I think, emergency management and public safety infrastructure that's changed since that time, that has put a lot of the onus on public health to do more of that community work. But you're right. It's just an evolution of the same kind of thing.
Yeah, and I was just wondering kind of how much do we start in the middle and just update as needed, or start from scratch?
I think a lot of, if I can comment, a lot of the plans that are put in place are really for any type of infectious disease that can enter the community. Ebola really challenged us to look at that in a very, very real way, that this is a possibility and we need to have plans in place, and just meeting with all community agencies and creating a coordinated plan for Ebola, but really it's similar for any type of infectious disease, such as bird flu, that could enter the community. Exactly the same type of responses. Some of them are transmitted differently, but it's similar in terms of preparedness.
Thank you.
So looking at future trends, what we did with the staff and the Board of Directors of Community Health Services is we sat down over the last several months trying to project how we see the organizations, what the mandates are going to be for us over the next 3 years, thinking that we were entering a new 3-year partnership with the Healthy Community Fund grant, and we needed to look forward to what we were going to be required to do, trends that we were seeing, so that we could fund those future trends, not just look at 1 year of what 1 year was going to bring. So I'm going to kind of walk you through what staff and the board have visualized for where we see the organization going and the demands that we see coming to us. And all of that recognizing the limitations of the Healthy Community Fund, and again really looking forward to an opportunity to have the Board of Health, the Community Health Services, Board of Directors, and staff work together to really prioritize what the services that Pickens County, the public health services that Pickens County wants to provide. I think this is an obligation of the Board of Health to determine this. And this funding request, I think, just sort of got us to the point where it's really time to do that now. We're at a crossroads where we've tried to take on all the additional work from the mandates over the last 3 to 5 years, and we've been successful. We can't continue to do that without a different level of funding. So I think it's time to confirm that this is what you want your public health agency to be doing, and determine the amount of funding that's needed to do that. So hence hopefully our consultant helping us out to take a step back and look at this with us.
Can I just ask, maybe Nan remembers it? It might have been before you were on board, Liz. Did we not do that? Times we have a record of what the discussion was on the Board of County Commissioners, or the Board of County Commissioners then, I believe. I don't think we were also the Board of Health then. I don't know when we became all of these boards, but we had a discussion on prioritizing the services provided. It could have just been the Community Health Board that discussed it. It could have been when Yvonne was here, but there might be some notes somewhere, maybe, or maybe not. Maybe we just start from scratch.
You know, I think it's a good question. The landscape has changed so much since the Public Health Act.
Right.
But anything we thought or were doing
So we
before
should just start from scratch?
Yeah, we kind of need to look and say, Liz is doing a great job bringing her team into the planning, partnership, emergency preparedness piece. And in doing that, it's putting pressure on the costs. And so if that's the case, and at the same time that things have changed with the Public Health Act, the medical providers have changed. We have a federally qualified health center now that's available to us. We've got some school-based health centers all the way from Basalt, Carbondale, and Glenwood. And so it really will be good to look at all of it and say, do we need, is there someone else who can do this? Do we outsource this? What do we do with it?
What are we doing? What do we need to do, and who else might be doing it?
Yes, and who else could do it for us?
Got it.
Exactly.
So these are some of the trends that staff and board see coming. So in Nan's memo and the introduction, she lists for you the core public health services that were mandated as a result of the Public Health Act, and these core public health services became law in 2011. So on the front page, you see there prevention and population health, communicable disease prevention, investigation and control, assessment and planning, emergency preparedness, environmental health, and administration and governance. So these are core public health services that every public health agency is mandated to provide or ensure that they're available in your county. Okay, so we perform, you know, of course we don't perform, community health services doesn't provide environmental health services. Those are provided by Pickens County and the City of Aspen. But basically, community health services has been charged with providing all of these other core public health services, some to a lesser degree than others. So prevention and population health promotion is one that we haven't fully enveloped in our work so far. And we see that as an extension of the public health planning and that the whole public health improvement plan work, but really looking at the direct services that we offer. We have family planning, we have women's health. We provide these, you know, immunizations are a core service of public health. What other community types of outreach, community education could we be doing? Not just serving the people in our direct services, but going out into the community and promoting immunizations, educating people about the importance of childhood vaccination, the importance of family planning and accessing low-cost birth control, and teen sexual health, and postpartum depression. These are top potential topics of prevention and population health promotion that we could see ourselves getting into in the future, to not only provide the direct service, but to promote them in the community.
Liz, when we were here, and who was the doctor on the board? He was really into the blood pressure, obesity.
Dr. Cohen.
Dr. Cohen, Morris Cohen. Blood pressure, obesity, of course heart disease, but diabetes was a big thing, and looking beyond youth, children, a family, but into the older aging population that we have. And recently, I think with the Valley Health Alliance, the issues that came up were stress and depression and sleep. Those were some huge issues that we might want to also bring into the conversation at some point. We have that information that we've just had, that survey that we just had that had some key points in it from the Valley Health Alliance that would be helpful.
Well, and I'll jump, based on that, I'll jump down to the third bullet, care coordination and the medical home model. And I'm sure you've heard of these concepts of community health workers and patient navigators and the concept of a medical home and integrated care. And you all know that this is a movement in healthcare, and Mount Family Health Center is a champion of developing this, as other private practices. But what's not lagging behind, but it is still evolving, is the role of public health in this whole model of care. So we could see ourselves becoming involved in care coordination or supporting employer groups in wellness activities, or having a more robust referral system, because as the provider of direct services, we are part of the medical delivery system in our community. And so we hope to, over the next several years, to really develop our role in that care coordination, medical home model, and it could include just what you described, Patty, getting more involved in those kinds of activities. And as I mentioned earlier, the second bullet is we will be expected to perform another community health assessment and write a new public health improvement plan in 2017. So that's definitely on the radar and is a mandate that we will be required to perform. And we've mentioned emergency preparedness. Up until, well, now, all this emergency preparedness work is done by myself as the director, and I think we're the only county in the state that doesn't have an emergency preparedness coordinator. And that work is just becoming more than I can manage as the director. And so that's an expanding need for the organization.
Is that one that could be shared with other counties?
We've looked at sharing EPR coordinators. We tried that a few years ago with Eagle County, and I think what we've learned is that you have to know the players locally, and you have to be present. You have to, each community is so different and the way we deliver those services are different. Haven't been successful at that yet, but we have looked at that.
Thank you.
Just follow up on that. Because I guess when I was reading through the memo, I kind of got the impression that, again, response to Ebola and international disease, the emergency preparedness response coordinator would be updating our response plans, but that it would be a one-time position, and you're seeing this is going on and on.
Yes.
Okay.
Yes.
Let me,
and
that's a
yes.
good clarification,
Yes.
because I thought you were talking about getting it updated and then people could put it into practice as needed. And so this does not relate at all to what we have for the sheriff's office for emergency response. There's no way to look at those two positions coming together, because the number one emergency preparedness from that perspective is wildfire, and how do you treat that? And then, of course, flooding and some other things. But I thought that health issues were somewhere down on their list of the threats to the community. And I'm just kind of wondering, is there a synergy or a possibility, you know, that networks with that position as well?
I think what you're describing is the county's emergency support function structure. So there's the ESF, number one, which I can't remember. There are 15 of them. Number one might be there's transportation, there's public safety, there's public works, and number 8 is public health and medical. So we are a part of that planning and response team.
But have to do our own planning efforts, and support coordination goes into that planning.
Yeah, so we are responsible to be present in a fire and think about the medical and the public health needs of a community in a wildfire or in a flooding situation. So in the public health world, they're calling the ESFA the Healthcare Coalition, which is really the same partners that we have convened currently. It includes the hospital, ambulance services, the coroner, environmental health, and emergency management to continually be working to address the public health and medical needs in any kind of a disaster, not just a public health disaster.
Okay.
So does that answer your question?
It does.
Okay.
Thank you.
So yes, Rachel, thank you for pointing out the clarification on that emergency preparedness growth is not just an Ebola planner, but an emergency preparedness coordinator for public health. Okay. And we're starting in 2016 to use those Ebola funds to get that person on board. But then looking beyond 2016 and 17 and 18, we were looking for a way to fund that position into the future. Let's see. In the early winter, we had a staffing change in our family planning program, and so staff and the board took this as an opportunity to reevaluate the value of the program. And so we sort of did this on our own internal process of deciding, should we be doing family planning? If we don't do it, who else will? And we looked at the benefits and the features of having those federal Title X, which are unique. We are the only Title X agency in the Roaring Fork Valley, and the nearest other clinics are in Mesa County or in the other side of Eagle County. Planned Parenthood nor Mountain Family Health Center have those Title X dollars. And they allow clients to access low-cost contraceptives and all the counseling and the basic physical exam, STD screening at a very low cost. Our sliding fee scale for Title X goes to 0. So based on your income, if you're at 100% of poverty or less, you pay nothing for your services. And there's no other place in the valley that has the sliding fee scale that drops to that level. And we see about 50% of the clients in that program live in Pitkin County, and a quarter of them live in western Eagle County, and the other quarter live in Garfield County. So we're serving women up and down the valley in this program. So we came to the conclusion that, yes, we needed to continue this program. And as you also remember from the spring, we were a participant in the Colorado Family Planning Initiative, which funded long-acting reversible contraceptives, or LARCs. And that funding ended as of June 30th, 2015. That was a grant over since 2009. And they knew it was going to end, and 5 or 6, it actually went on longer than we thought. But it gave us dollars to purchase those expensive methods and give them to our clients for free. And as you remember, it was hugely successful in Colorado and many other states, and foundations are trying to duplicate that work. And there was legislation last spring to I think, had $5 million from the state's general fund to continue to support that program, and it was not passed. So the state of Colorado is still trying to find other methods of funding for that. But so as of right now, we no longer have that LARC funding to provide those methods to our clients, and hope that the state comes up with some additional funding to continue that.
Governor Hickenlooper just last night spoke very highly of the LARC program and how successful it was, but I don't recall that he said that the funding had ended.
Yeah, he did, that the grant had run out, but that they were both looking for money internally in the state. Could they find a way to do it? And also to see if they could find some new private donors who would jump in.
Yeah.
Right.
Because a dollar spent on the LARC program saves
Yes.
$20 down the road
Exactly.
easily.
Yeah.
And we saw those impacts in Picken County. And I'm realizing I need to get going here. Let me see. So I really want to just take you through some trends over the last 5 years, 5 or 6 years. This just shows you overall on income and expenses, our operating expenses. And you can see from about 2011, we've been operating in the red. And I can explain, that was primarily we lost the Aspen Valley Medical Foundation grant in 2011, and which has never been replaced. And even you see in 2013, everything sort of increases. That's when our Healthy Community Fund grant was increased from $271,000 to $320,000, but we're still sort of operating a little bit under. And in 2014, at the end of the year, we did have to pull some funds from our reserves due to low cash on hand. So that sort of explains this. This sort of breaks our income down into our major income categories, which include client fees, our local contracts, which include all of our local government contracts and our Komen contracts, state contracts, and donations. So just in general, our client fees, the bump in 2010 was related to taking on Eagle County prenatal, and then that sort of leveled off. And now I think the increase in 2014 has somewhat to do with insurance income and collecting that new source of income there. Our local contracts in the dark pink at the top, again, I described that earlier. Picken County grant increasing in 2013, losing Aspen Valley Medical Foundation in 2011. State grants, I think that slow rise had to do with the LARC funds over all those years, and then a decrease of those funds, and they started to go down in 2013. In the way of expenses, trends in expenses over the last 5 years, the orange line at the top is wages. So there you see a big bump in 2013 related to adding the public health planner position and the medical billing specialist in 2013. All the other expenses have pretty much are remaining flatline, and it's really about the people. All the work we do is done by the people, and not many of them are income generating programs, particularly the ones that we're adding, like emergency preparedness, public health planning. So again, our primary income sources, which I've just noted for you, some of them are pretty fixed. Our client fees are set on sliding fee scales or discounted services. We can't increase them enough to really generate additional income. We've talked about our insurance income. Not really, we were hoping that was going to be a viable source of income to get us out of this, but it hasn't yet. We're still continuing to see a large number of uninsured, and I think that, back to your point, Rachel, that part of our program management, program requirements, I think is going to require us in the future to do a little bit more than just refer people to Connect for Health Colorado, which we do all the time. We're always referring, but I think that we're going to see increased requirements for us to do a little bit more about that. But we're also going to continue to see those people who are never going to be eligible for insurance as the safety net. I'm sorry. I wanted to just have you look on your attachment D, which is the 2016 budget, to quickly kind of show you what we're going to see, what you see in the 2016 budget. So our trend is we're giving fewer flu shots and fewer immunizations in general. So in terms of client fees, that number is going to be reduced. In terms of local contracts, we have asked Eagle County to support us in our family planning program because we do serve a significant number of people in that program, and so we're hoping in 2016 that we get some funding from them for our family planning. And of course, a lot of these other numbers are assumptions. We ask in our budget, we put an increase from the City of Aspen, but we really don't expect to get it. We asked for an increase from Snowmass Village, which we've done before, but we so those funding levels have been static for many years from this, and we continue to see our Coleman grant decrease. So local contracts overall, we would like to see them increase.
What about funding from Garfield County? Sorry, you mentioned.
I have approached them and are in conversations with them about specifically funding for Title X in our family.
Sorry,
I hope you're successful.
Yeah.
How
we have
about
a
Basalt? We have residents in Basalt.
We get a very small grant from Basalt.
Okay.
It's not measurable by any means.
Okay, thank you.
Really, an overall a decrease in our state grants other than this one-time Ebola funding. And so it's an overall 14% increase in our budget. And just to save us time, I'll surely answer any questions you have. But so in our best case, in the best world, if we were going to do everything that we wish we could do and are mandated to do, this is what we've calculated. We would, our budget would include a $454,000 asked from the Healthy Community Fund, which is a 42% increase over our current grant amount. It would be 37% of our total budget, which you're currently at funding 30% of our budget. And so with the in-kind rent that you provide for us, it would be a total of 41% of our budget. So,
And
more questions?
majority of the rest of your budget comes from pass-through dollars from the state and the feds, insurance fees and...
So we have our client fees, local grants, state grants, our primary sources of income.
Okay. It might be good to see a pie chart on that.
Okay.
Now that you've got it.
I've done that in the past, but I didn't do that this time.
Well, it's just tentative so far.
Yeah. Okay.
Quick question, and it might be for Mitzi. How much does the Healthy Community Fund increase, or how much could it potentially increase?
We never really know that figure until around the last week of August when the tax figures come in and we can see what it will be. It's been around 1.9 million every year since we renewed the fund. It has not gone much beyond that or lower than that. So we'll know by the end of this year.
It should go up this year.
Yeah, it is de-bruised, I believe. Is that?
It only increases by growth and inflation.
Growth, so it's not de-bruised. So even if property values recovered quite a bit.
So we're really hoping, and this is a difficult conversation to consider or discuss, and maybe there are some other next steps we should take, but we're looking for a recommendation that staff would then take to the Healthy Community Fund and take the money off the top, so to speak, so the grant review committee can review all the other grants and make decisions on the other pressing needs.
So are you asking for approval for the 42% increase, or?
No,
That's going to be part of the...
That's what Liz is asking for, and staff is recommending a much amended
The
amount.
130.
358,000 with 30,000 from the general fund for a consultant, right? And then taking community health out of the Healthy Community Fund grant cycle, even though they're still funded from there. But we kind of need to look at them annually because unfortunately they hold for 3 years and then there's this huge pop instead of being able to look annually at the needs and the pressures and where we need to go. So.
And it really does pertain to the fact that all the other applicants are nonprofits who are serving us with their own strategic plans and goals, and community health has a piece of mandate in public health, as well as a nonprofit status, so that's what makes it different.
So the increase that's being recommended would just keep things pretty much status quo in 2016, would not really fully cover the increase in just the cost of doing business, but with no plan or action being taken to do any of the additional things that we see coming down the pike. I mean, we'll have the Ebola planner because we have dedicated funding for that in 2016. But beyond that, none of these other new initiatives or would be funded in 2016.
And just to be clear, that we're looking to start the consultant in 2015, so that we could actually take a different action as soon as that report is concluded. But right, so holding them at this amount would be holding them until we get clarity about next steps.
George?
Oh, no, I'm
good.
I just have a question, and I used to be on the Community Health Services Board and clearly understand the challenges that are put in Liz's footsteps each and every day and what's coming down the pike from the government. Recognizing that it's a 501c3, is there funding from other foundations that can be approached? And if so, have you been successful with some of the front range foundations?
We have never applied for those, I think because we have not been in that big population health business very much. You know, not many of them, to my knowledge, fund those direct services. But we have not explored that in the past because of the type of services that we've historically provided. The direct nursing services were funded by the state grants, and we've never had to been forced to do that, but we are totally willing and to look at other funding sources.
The other, I have a follow-up question on that. As several of us spoke in a conversation at our day, and in the audience were many funders, and my theme has always been the impact of global warming and the public health crisis that is coming in various parts of the world that we've already seen and have experienced, and I'm personally doing a lot of public health work in other countries that have been devastated, understand the impact that brings. It would appear that some of those funders sitting in that audience might have an ear to the future needs of what we might see here in Pickens County or in this region relative to public health crisis and needs. So it might be interesting that you might want to loop back with Chip as to who some of those foundations were or are. I don't know if you have a list. I didn't get to any other sessions, Steve.
I'm sure they would have a list of the
I would think so.
different people, yeah. We could get that.
Okay.
And we did participate in the recent philanthropy days.
Good.
And met some funders
Yeah,
there.
there.
So we've begun
Okay.
that process.
So the
Dan?
different, oh, sorry.
Ann, go ahead.
So if we go with staff recommendations, you would be out of the grant application process.
Yes.
As I understand. Then how would your budget requests be reviewed on an annual basis? If it's not through the application process, it comes directly to the Board of Health, and
I think, as Nan mentioned earlier, it would be part of the county budget process on an annual basis. Is that right, Nan?
We still would come in August to get a sense of the annual funding, and we can work on tweaking what exactly it means, but I think it would be helpful if public health had a budget profile, just like human services does a budget profile on senior services, so that the county commissioners and the Board of Health are, you know, as you said, Patty, kind of looking at the whole broad sense of need of mandated services, resources, and income. Those are just some ideas I have, but what happens with senior services is they complete the county budget process. They do a mid-year and annual report for the Healthy Community Fund. based on some outcomes that we've agreed on, but they don't have to do the grant application and, sort of be a part of that piece.
And then the need for the consultant is just all the changes in the last 3 years.
I think it's to help us, help both the Community Health Services Board and the Board of Health look at public health in Pickens County and help us look at where that whole process of is there another place for this service to happen? What does Community Health Services have to provide, or what could someone else provide? And the complicated nature of our governance structure. How should all the fund, what should the process for Community Health Services be in a budget process?
What are other counties doing?
What are other counties
happening around
doing?
the state?
Everything.
Rachel?
Yeah, we are naturally unique by having a nonprofit board in community health, and others have their community health as a pure county department. So that's a uniqueness, and I do think that that is something that the consultant needs to be able to weigh in on and comment on, and do we want to continue to proceed that way? I personally don't know which would be best, but it'd be helpful to know to what level has being a nonprofit assisted with additional fundraising beyond the normal pass-through grants and so on, because a lot of times that seems to be part of the goal of a nonprofit board is, other than the expertise and certainly the volunteer time in management, well appreciated, but is there a fundraising role for the board as a nonprofit that could assist us? And I guess the difference between the two proposals of community health coming forward and then our staff recommendation is about $96,000 a year between the $454 that you would like to request and the $358 that is being recommended by our staff. And of course, some of that's from general fund and some of that is from a state grant that's only one time on the International Disease Planner, Emergency Planner. So it makes me wonder whether, how long the consultant's work would go on for and when we could expect a report back so that perhaps we could look at a mid-year adjustment to this budget. So that even if we proceed, under staff's recommendation for now, I think it'd be short-sighted to just pretend that that will be enough and then community health gets going and, and you guys figure it out. I don't think that that's an appropriate. I'm also not prepared at this time, and knowing some of our other fiscal constraints and issues, that we can't just commit that type of money on an annual basis from the general fund either. So I'm almost wondering if we're going to be asking too much out of this consultant planner request for answers at the dollars that we're allocating towards it. But I do want them to really be able to look at all those issues, because our very last discussion was about how limited the availability of Medicaid providers are in our community. The shortage on the dental facility. And it does raise the questions of, would there be a combined benefit of working with the Mid-Valley Health Center more directly? Would some of our funds be better spent? Actually, total random idea, but here we've provided a house. You can live rent-free if you come to our valley and be a Medicaid doctor and take Medicaid patients working in this office. Where will we get the most bang for our buck and the long-term bang for the buck for the client? So I'm willing to move this forward in that sort of sense, and others have suggested it too, but really perhaps reach out to Aspen Valley Foundation through the SKICO as part of this transition year and ask them if they would assist with this challenge going forward. So those are my general thoughts on this.
Connie?
Well, in an effort to move this along, since we do have an audience, just so the audience knows, we have a group moving out so you guys can move in. But what's the process here? We, as the Board of Health, cannot approve funding from the county general fund. It will have to be then recommended back to the Board of County Commissioners, correct?
So you would make a recommendation, and if you recommend the 30,000.
Just want to make sure we clear that up, who's spending the money here. I feel comfortable moving forward with staff's recommendation with the caveat that the consultant, we would like a mid-year budget so we can reevaluate what the standing is, so we can continue an operating cash flow for community health. through the mid-year. But I think that's the direction we need to move into, and then bring it back to the Board of Commissioners for the Board of Commissioners support and move it on.
So what we're saying, just so I'm clear, is that we're going to follow the staff's recommendations, and that those dollars then will be taken out now from the Health Community Fund. So when the Health Community Fund Committee starts to look through those grants, the amount.
Those funds are not available.
Those funds are not available.
They're protected.
With the consultant fee coming through.
The
and then moving
consultant fee, we're recommending come out of the general
Right.
fund for 2015, so we can get started and bring you a mid-year report by next summer and map out the plan and how we're going to do this.
I would like to have the consultant have clear guidelines on milestones they need to meet, deadline. We could get a set of action plan kind of things like like we've done for the Aging Well initiative. Very specific things that community health can work on with targets. That would be a good outcome, I think.
So Steve, do we need a motion then, or do we need a motion to approve a recommendation of the Board of County Commissioners? Is that the process, Nan, we should be using here, or is John?
To me, that seems like that would be appropriate. We could make, we're in a...
Well, I'm going to move to make a recommendation to the Board of County Commissioners to remove with protected funds the community health services from the Healthy Community Fund grant process, thank you, with a $30,000 consulting fee coming out of the county general fund with a mid-year reevaluation of the financial situation. Does that cover it?
Well, maybe that's enough in one motion. I'll second that. And then if there's anything else that we need, we can make a second motion.
Okay, Sarah, it's been moved and seconded to do what Patty just said. And I'm not going to ask Jeanette to repeat that right now. Is there any further discussion on that motion? Seeing none, all in favor say aye.
Aye.
And was that also, again, I got lost in the middle, but was that a recommendation that the community health does not go through the normal?
Yeah, I started off with that. That it's a
And the
protected fund in the
funding,
community health grant cycle.
Did that include the funding level of 358 for 2016?
Yes, it was with the additional.
Awesome. Then you got it all.
For 1 year with reevaluation mid-year.
Awesome. Okay.
I covered it as best possible.
I think you did a good job.
Thank you.
Thank you.
So
Thanks.
thank you very much, and if you could give us periodic updates on, well, we have to go back to the BOCC first on the
Seems fine.
recommendation, but
Okay.
We'll see what those
All right.
presuming,
Yeah, we'll see what
presuming
they
we
say.
forward it on, we hope to get periodic reports.
I just wanted to say, on behalf of the board of the Community Health Services, which I've been on for 2 years now, and it's just an amazing group of dynamic and committed people, and just everything that Liz is doing, the expansion of the roles, and really appreciate the support and for these are critical issues in our community and support for a healthy community. So.
Great, thank you. I'm going to do, we have to do a motion to adjourn the Board of Health
Yes, and it's a special meeting also.
and special meeting.
Second.
All in favor of adjourning, say aye.
Aye. Thank you. And we have
Thank you very much.
10
Thanks,
minutes?
Liz and
Thank you. About 5 minutes?
Dr. Levin.
Probably a few minutes.
I'm going to need a few minutes.
Okay, welcome back to the August 11th
Should make a
work
public
session of the
announcement?
Board of County Commissioners.
An issue with the rest.
Next on our agenda is discussion of the High Valley Farms odor issues. And let's see, oh, John's not here. We have Laura will be doing the presentation, as well as I think Kurt for the county. So what we're going to do is we'll have county staff will present first, then we'll have Jordan's team do whatever presentation you want to make. And then I will ask how many of the public wishes to make a comment so we can get a count and kind of judge the amount of time. We need to allow plenty of time to bring it back to the board for discussion at the end. And we're going to try to limit the whole thing to an hour, but if we have to run over a little bit, we will do that. We want to make sure that everybody has their chance to speak. So starting with the county staff presentation, Laura.
Yeah, so the board heard this issue originally on June 9th and directed staff to come back in 60 days and update the board on any odor issues and progress or lack thereof of abatement of those odor issues, so that council at that time could decide if they want to take any action on the license or no action at all. And so what we've got here today is Kurt available to answer any questions you guys have. I don't think he has anything prepared for you. He's included his report of odor observations in the packet materials, and obviously I'm here to answer any questions as well. But basically it's here for the board to decide if they want to take any action on the license. You could do any number of things if you found it to be in violation of particular parts of the code relating to odor, which has been the allegation. You could easily hold a hearing on the license in the future. You could partially suspend the license in any number of ways. You could do it in terms of time of year that it's allowed to operate. You could do it in terms of hours it's allowed to operate. You could do it in terms of portions of the facility that are allowed to operate. You could revoke the license, any number of things. So I think this is really to give the board an opportunity to hear what the situation is from both the applicant, the license holder, as well as residents around that facility. I did want to let you know that the applicant has applied for their renewal at this point in time. The hearing hasn't been set for that renewal of the license, but we anticipate that there would be time on the September 9th agenda if that's something the board wanted to do at that time. So looking at timing, if you guys do want to move forward with any action on the current license, how that would relate to the timing of a hearing on the renewal of the license, because that's coming up in just about a month.
Rachel, then Patty.
Yeah, Laura, just for clarification, when does the current license expire, and what would happen if we just let that license expire with no
So
renewal?
it expires on September 24th.
Okay.
And you have a new application in front of you.
Mhm.
So we would have a hearing on that application.
Okay, thank you. And but again, with no intervention, it would naturally expire that date, and then there would be a required hearing for the new.
For the renewal application.
Thank you.
Steve, I have a question, not specific to this license, but to the High Valley Farms license, but the license for the medical operation that's across the street, which I know is a separate issue. But there's been a lot of reference in all the letters and comments that received. That license or that operation was supposed to be moving out. Do we know the status of that?
Kurt may have information we don't in the attorney's office.
Does Jeanette have any? So we don't know, we don't have any authority, we don't have any jurisdiction over that license?
Well, we have jurisdiction and authority over the license. We do.
If I could just step in for a second. There's a number of situations that we encounter. There's legal grow operations that are unlicensed, which are typically medical marijuana where they're growing as caregivers. And I believe we do have one of those situations in the area. Then there are legal licensed facilities for recreation and medical, which is what we're here talking about today. In terms of the legally unlicensed facilities, we do not have the same kind of process available to us that we have today. And so just to be clear, I think we've got both situations going on in
But the
in this
operation
area.
across the street is a legally licensed, but not under our purview?
It's, my understanding is that it's under the state licensing system, but not our local licensing
Right.
through the recreational system, just a caregiver license.
Okay, and we don't know the status of that, because facility, it was my understanding it was supposed to be vacated the end of July, was what I had heard. but we
I don't know the status.
Okay, just wanted to get that clarified before we start.
Okay.
It's very complex.
Do you have anything else?
No, we're
Or-
really
or
here
for-
as a resource
Just
for the
more to
board.
answer questions as they come up. Okay. Jordan, would you like, if you could come and sit up at the table?
Thank you. Okay. Well, no, thanks. Mike Woods is going to join me here. He's been...
And for the
sure, for the record,
television, introduce yourself,
sure, I'm
please.
Jordan Lewis. I'm one of the owners of High Valley Farms.
Mike Woods, one of the owners as well, and COO.
So, obviously, this has been a top priority for us for quite some time. And I know there's going to be a lot of questions from the board. I'm hoping just to run through just a quick synopsis before sort of answering any specific questions, if that's okay. I just wanted to go back to sort of when we started this process. We became aware, the initial system that we had purchased in the original design of the system, we became aware that it wasn't functioning adequately in about mid-February, I think, April, beginning of April. And we started taking corrective actions. On the 29th of April, we engaged with the hydroxyl manufacturer, the representative who has joined us today to give some more information, to come and take air samples. On May 5th, we got the analytical results, which is it's a mass spectrometer, I believe. It tells you exactly what the compounds are. And that enabled them to go back to the lab and start testing with terpenes. They're based in Maryland, so they couldn't use cannabis, but the same terpenes are found in lemon and other things, and start mimicking it and testing it in a controlled environment. On May 11th, on May 20th, the design work on the hydroxyl system began. And the normal process for a system of this size, which this company has done for large industrial applications such as rendering plants, cruise ships, the typical lead time from design to installation is close to 12 months in an expedited project. We have fast-tracked this to the point where we're going to accomplish installation in about less than half of that time. We had on 9th, we had the BOCC meeting, and at that time we told you that we had 3 technologies. The existing mist vapor system, which wasn't working adequately, but we had the parts on hand at the time to get it running better, which we did within a few days of that meeting. That system still was not adequate, and then we installed the dry vapor system on, I can go back, soon thereafter, and there was...
3rd of July.
The 3rd of July, thank you.
It was a dual.
It was, yeah, and the 3rd of July, we were on a temporary pump, so we could only run that system during the day, and at nighttime, we were going back to the vapor system. On July, the engineering and testing was sort of figured out by the hydroxyl company at the end of June, and the manufacturing of that began towards the beginning of July. So that as Rachel asked us and implored us to do, and we didn't miss a beat, and we were working on that from the beginning. We had hoped that the vapor system would solve everything, but we're realizing the limitations on that. And the good thing is that we haven't missed a beat on the hydroxyl, and we're within about 2 weeks. What's the date of delivery now? 24th of August, the first hydroxyl unit's scheduled to be installed. We should have all the analytical results back, so we know exactly what we're dealing with. and then we can go ahead and order the units for the other system. So I just want to, just to bring it to the attention of the board that we have not for a moment rested on our laurels with any of this. And at the end of the day, we early on identified hydroxyl as the ultimate solution. It is obviously the most challenging from an engineering standpoint and a logistics standpoint, but we have been moving, we've had about 10 people working on this full time. In the interim, the board had asked us to do several things, and I just want to bring everyone up to speed on what that was. We were asked, we told you that we would get the misting system updated, and we did that on June 12th. On the 18th, we set up a website where people could record complaints and give us information that we could go out and verify it in the community. On the 23rd, we began scent observations, of which we've collected over 500. We had a full-time person, and mostly full-time, doing that several times a day at various observation points throughout the community along Highway 82. And unfortunately, there was no data at all provided to our website, so the only information we had to go by was what was being reported on the Roaring Fork Skunk Smell website, and a lot of that was non-specific, so to the best of our ability, we picked up on the specific ones, and we figured out where those complaints were coming from and set up observation locations to do that. It wasn't until July 27th that we transitioned from the dual, going from the dry vapor system and the mist combination to the full dry vapor system. So that was on August 1st, I'm sorry. The 27th to the 1st was the transition. Where we are today is and I think this is one of the best ways to explain where we are is based on the technology we're currently using. We're using a neutralizing agent, and the neutralizing agent, in a perfect balance, it will eliminate all the terpene molecules, and there will be no residual odors. Unfortunately, the conditions of the greenhouse are variable, depending on a host of factors. The terpene levels can be increased or decreased, and so really, in order to make sure that we're not emitting any skunky, cannabis odor, we always have a margin on the side of, making sure that there's enough to neutralize the cannabis smell. And and that has happened. The cannabis smell has been neutralized. What has happened also as a result is that the neutralizing agent that is not used, the way this works is there's a radius from the point of dispersion. And as it goes out, if it hasn't already interacted with terpenes that are in the house, it's going to interact with whatever's in the environment. So there's a radius from the point of exit from the building, and it's going to interact and deactivate in that radius. What happens though is that if you're within a very, this is probably within 300 to 400 feet, 500 feet, and then it's gone. It's interacted and it's gone. We're putting that out directly onto Highway 82. And so the result of this has been when you're driving down Highway 82, it's like taking a net in a river and running it up and down the river, because from whatever vector the wind is taking that, you're going to intersect it the majority of the time. So driving in a car, our observations, so we took observations driving up and down 82, at stationary points along 82, and then up into the Holland Hills community. And what we observed was that there's the most odor detection is actually driving, because you're inevitably going to intersect one of the vectors that the wind is coming off. And you're also in a contained environment, and so whatever molecules are captured, it's actually, what we've found is that it's worse if your windows are shut. It gets caught in there and it's noticeable. And sometimes you don't notice it several hundred yards past maybe where you encountered it. So and our observations, we picked that up about a third of the time, and I think that was in line with Kurt's observations, that there was some. But that odor that's on the highway is the neutralizing odor. It's a much different smell than raw cannabis. One of the benefits now as well is that we can identify what's coming from us and what's not, because everything coming out of our greenhouses now is being treated. Our observations from fixed points along 82, we about 15% of the time you could notice the neutralizer agent, and then when you go into Holland Hills, there was no detection of the neutralizer agent. And we have those locations. We're up at the intersection of Kelly Court and Holland Hills, and then another one was.
I can pass these. Sure, for the
there are
detection points.
three. one on Hopeland Ranch Road, one up on Holland Hills Road, and one by just before the Alpine Kennels. So based on our observations, and once again, we've been methodically collecting these. We hired an odor detection company to come out and certify us in the use of their equipment and to train our staff on how to do this. What we've determined is that there is a neutralizer. There's the lingering smell of the neutralizer on 82, and a lot of the comments that we've received from folks is yeah, I smell something down on Bishop Lane as I'm turning in, but I get nothing up by my house. And I realize that there's a lot of there's a lot of other folks here who are going to have different opinions on this. I can only speak to the facts, and this is what we've come up with. And I'm not hiding behind anything. I'm acknowledging that there is this neutralizing agent on 82. The good thing is that the hydroxyl technology differs from the neutralizing agent in a very key way, and that is the hydroxyl in and of itself has absolutely no odor. So we have designed a system that can handle 10 times the calculated load of terpenes, and we can apply that in the greenhouse before it even exits. And so therefore, if there's any hydroxyl that has not interacted with the terpenes in the house, we can always make sure there's an adequate buffer. It's not going to have any residual odor on the highway, and certainly not beyond. And this has been once again, I mean, I can't, the cost of doing this, the intellectual, resources that had to be put into this, we drove a process that by any reasonable means should have taken a year, and we're getting this done in a 5-month period. And so right now we are, and I'll defer any questions to Derek here, who designed the system and is a PhD and can explain this a lot better than I can. But we feel at this point in time what we've done is basically gone from a broken system that was emitting raw odor into the community when we first showed up. It was malfunctioning, it wasn't working, and we acknowledged that at the time. I stand here before you today, and I can confidently say that what we've done is we've dramatically reduced the radius from which anything is emitting, and the smell of cannabis is not the issue now. It's the neutralizing agent, which is, it's not perfect, but it's a much less noxious odor than I think by most people's observations. So in the next few weeks, we're going to have the hydroxyl unit installed. We're going to test it, and then within 3 weeks after that, by the end of September, we should have the remaining hydroxyl units delivered on site and being installed. The key thing as far as what we've done as well, we heard the board's comments about concern about plant count and everything else, is that the folks at the hydroxyl company, and I'll let Derek speak to this directly, but in order to make sure that the system is going to work into the future, we need to test it under real world conditions, under the real load conditions. And the first unit is really the most important. So what we've done is we've altered our strategy as far, or our process of growing, and what we've done is we've staggered the houses now so that the house that's going to be the ripest in a couple weeks is going to be the first one to receive the hydroxyl unit. And then we should have several weeks between the other 2 houses that are flowering houses that will, that by the time that they get to full sort of flowering stage where they're going to be giving off the most odor, that those hydroxyl units should be on site and being installed. And this will allow us to calibrate the units correctly to accommodate the worst case scenario into the future. And that is a general synopsis of what we've done and where we've been on this. And is there anything
Can I ask some questions?
Let's have questions directly for Jordan right now.
This is a very simple question.
Yeah, sure.
We've heard concerns from the neighbors too about outside of the ventilation system, just the opening and closing of doors and the release of untreated odor at that point. Do you have, I've not toured the facility, do you have in your entrances or exits, do you have like a reverse laminar flow or some kind of air control system?
We have airlocks on every greenhouse, and then we have airlocks. So there's only one door that people come and go out of. Every greenhouse has an airlock built into it. and then there's an additional, probably two doors that have to be opened and closed. So, at the end of the day, I think that's, if there's a small amount of residual odor coming from there, that can be easily addressed. Right now, that has not seemed to be
A focus of your
a
attention.
focus. Yeah, exactly.
That was the concern of people. If we cure the problem X here,
Right.
what's happening with the problem Y here?
And one of the other things that has, and I sat here in the other meeting and I listened to what everybody said, and I made a point to just observe and listen and try not to defend myself in a way that people would think I'm being disingenuous. But I have to sit here today and say that, in the last 2 months of driving around these neighborhoods, Holland Hills we are aware that it has more than 5 grows in that neighborhood, directly next to a lot of these places where we're receiving complaints. And there is also an illegal manufacturing operation of basalt. I'm not here to, these things exist, okay? And there's not just a few of them, there's a lot of them. And if you even go on Google Maps, you can see a whole bunch of things that, that would raise your eyebrows and make you, wonder what's going on. So, but we've been in the neighborhoods with, basically nasal odor amplifiers, and we've been talking to people, and we know that this is part of the issue. And another thing that we've observed is that a lot of complaints have been coming at nighttime. All of our growing, our light cycle is during the daytime. At night, when our lights are off and it's cool out, our ventilation system is running at an absolute minimum. It's the exact opposite with most, indoor grows, because they're going to be venting at night when the air temperatures are cooler and it's easier. They don't want to run the lights during the day. So there are a host of other factors. I'm not, I'm directly acknowledging where we are with us, but at a certain point in time, we all have to acknowledge that there are potentially other contributing factors, and that we're never going to be able to solve all of those other factors. We can solve our problem, and I think that we've been working diligently towards that. And I feel that if the county commissioners can give us the time to install this hydroxyl unit, we will be at a place that is indisputably in accordance with the requirements of our licensure. This is, once again, this has not been something that we have just been pressing as hard as humanly possible on this, and we have spared no expense at all in getting this done. This is, our goal is to be in this community for many years to come, and we realize that this is what it's going to take. So.
Rachel?
Yeah, that's a lot of information to hand out at once, and I'm not disputing what you say, but I would like, since you have brought it up, to have a little more information about what you perceive to be the size of these five grows in that immediate vicinity or directly within the Holland Hills neighborhood. They're caretaker type grows, so that we don't license and we don't see and we don't have the authority via the state to do anything about.
Yeah.
But what do you believe, from your information, are the magnitude? Is it a caretaker who has 6 plants for 1 person, or is it a caretaker who has 60 plants for 10 people?
I think the numbers are far in excess of that. Several hundred plants in certain cases.
In and around this immediate neighborhood?
Absolutely, yes.
Well, Rachel, can I just add to that?
And we're aware, everybody knows one of them.
Yeah, I know, we're aware of the one in the old electric building, but yeah.
Well, I spent a significant amount of time in the South Side industrial area, and there's a grow site there, and I can smell it almost every day in the parking lot.
Right, and to the point, the complaints that we're getting from Hesperian are over a mile away. That's not, there is, I cannot see any possible way that is coming from us, given all of our observation points and how we know that this disperses. But we did actually, because we were getting complaints, we did go down there and monitor. And one day, we picked up a raw cannabis odor. But the wind was blowing from down valley. So once again, there are situations that we can acknowledge and we can try to fix with good information and cooperation. But when we're faced with claims of everything from, keep in mind the radius of Hesperian as well includes most of Elk Run and most of the South Side community. And nobody has ever, you know, I just find it implausible that if that was really an issue, that we would be hearing from a lot more people in those communities. And so, and once again, now it's for us, it's easy to detect what's ours and what's not, because we're not emitting any raw cannabis odor. And there have been ongoing complaints of raw cannabis odor, and that is not coming from us since we had the dry vapor system up and running. It's just not.
Okay, thank you for answering the question.
Some questions, Jordan. What is the neutralizing agent used in the dry vapor system, and what does it smell like?
I'm not sure how to characterize the smell, because it
Smells like marijuana.
It's a musty citrus smell from what I know.
It's an organic molecule. It's derived from plant material. I don't know exactly what's in it, but it has a much subtler odor to it. It's not it's not kind of hitting you over the head with, oh my God, what is that? It's a subtler odor, but it is noticeable.
Is there any danger to human health from inhaling?
No, it's an organic. It's totally organic. It's completely, it's OMRI listed. It's completely safe.
Steve?
And the same with hydroxyl.
To me, driving by, it smells almost, it's like a musty citrus kind of a smell. You can definitely smell something different in that direction. And it's not this dead skunk that's always there, that seems to be, that I have to avoid in the road, but.
Yeah.
Would you classify it as an essential oil, which is a term I've heard?
I don't know what the technical term is, but I believe it is composed of certain essential oils.
Okay. Question about the hydroxyl units. They sit inside the greenhouse actually and treat the air inside the greenhouse, or are they attached to the ventilation system going
So it's
out?
a dual system that we've designed. So one part of the system picks up the air in the greenhouse, treats it, and then releases it back into the greenhouse. And that's to reduce the overall load in the greenhouse. And then we have a separate unit that is essentially, it's covering the exhaust inlets with 10, up to, it has the capacity to do up to 10 times the calculated volume of hydroxyl needed. And so that's directed in a plume to cover any exhaust. So the reaction would occur prior to it leaving the greenhouse. And once again, I'll defer to Derek. I think he's a great resource and can answer a lot of questions if the board has some.
One more question about that. Once the unit is installed, I take it it's probably not readily movable to another greenhouse. If you only had one for 3 weeks.
No, it's
or would you be able to move it from one greenhouse to another?
No, it's installed per greenhouse. And so what our plan is, this has never been designed for this application before. The technology is well. In fact, this is the same company that the gentleman who commented the last time was using their technology in his house with a lot of success. So the technology is very well known, and it's really just simply a matter of engineering it for the specific application. So it's a designated unit. It lives in the greenhouse, and our goal is that the time for them to get 3 more units to us is about 3 weeks. And in order to avoid a situation where we had 4 units that needed to be changed for some reason, the best course of action, even though it's going to create an additional 3 weeks, is to get the first one in, make sure that everything is working as it was designed to work. And then as soon as we have that, and once again, we have a third party sampling this independently for VOCs, which are volatile organic compounds, both inside and outside. And once we get those lab tests back and it confirms everything, then we go ahead and we order the 3 other units and we have them installed. In the interim, we're working through the permitting process with Brian Paul and Kurt Dahl, and we can start some of the preliminary installation work, some of the electrical and the structural stuff, so when the units arrive, we can put them up in short order.
Okay, and one other kind of an operational, which I think I know the answer, but I need to ask you. If you only have one hydroxyl unit and it's in a greenhouse where you're harvesting all the plants, so then that greenhouse is empty, the hydroxyl unit is sitting there not being used for that greenhouse, is there any way to move plants from another greenhouse into that one or not?
Not really, and I don't know the feasibility of relocating because I think it's a pretty complicated installation. But what we've tried to do as far as our timing is concerned is that we've got 3 houses that are in flowering, and so we're going to install it in the one that is the sort of the most ripe at the time, and then we should have a period of about 4 weeks before the next house up, because right now we have one house that's basically empty. And so, that's not going to become an issue in the next, probably for the next 4 to 6 weeks. So our hope is that, the timing is that we'll have the other units installed in time to accommodate those issues. And we're making the best of what we have available and pushing this as far as we can.
Okay, and the hydroxyl unit doesn't emit any odor?
No.
Okay. And what is the hydroxyl, the word hydroxyl, what is that?
Sure.
Describe the process or what?
Can I turn this over to Derek and let him explain
Please.
if you don't want to?
Derek Sprosen, I'm Technical Director with Perfex Environmental, which is the company that's developing this. We're represented locally by Colorado Air Technologies, so we're from Maryland, quite a long way away. It's beautiful to visit this part of the country, but we do have local representation. Hydroxyl refers to OH minus. It's a naturally occurring molecule from the action of sunlight, the UV portion of sunlight and oxygen. It's nature's way of kind of cleaning things up. We're doing that in a controlled manner using activated oxygen that we have an oxygen concentrator, and then pass that activated oxygen that's moisturized into a UV light chamber with photocatalytic material that will transform that into hydroxyls. So that's what it is, very simple, and it reverts to oxygen and water vapor when it's done doing its thing, if there's any excess.
So the terpene would interact with the OH minus?
Correct. That's looking to break those bonds in the carbon-hydrogen backbone. And if there's sulfur appendages or any type of thing that's generating a smell, it works extremely well deodorizing for hydrogen sulfide, any of those other type of nasty odor generating, and works very well for the VOCs.
Okay.
Steve, can I do a follow-up question on that? And does that present any health risks to the workers who would be in the plant at the time those molecules are doing their thing?
No.
No.
You can I check?
Yeah.
So the final emission that would be going out into the highway corridor and to the neighborhood would be oxygen with a water vapor?
Water vapor, correct.
George?
So where have you used these? Can you give us a couple examples?
Sure. We use, have sold these units from residential to industrial applications. Residential for ordinary odor control, mold remediation, smoke damage for restoration type people, people that are worried about cigarette smoke, hotels and that type of thing, or cars. Also, if someone is worried about VOCs from paint and from having small children, taking care of that. And then moving into healthcare, ambulances, sold a lot of these for ambulances for taking care of viruses and types of things on surfaces. Nursing homes and the associated odors. Cruise ships, close proximity type things there, and also they have to retain their garbage on board now, and that's becoming a big issue for them. That's obviously a big smell generator. Up to very large systems, rendering plants, industrial applications. The difference there is that's a constant level of odor that you can go for. In this case, you're generating the VOCs in a closed area, and then you're opening that up. So you've got as Jordan said, we have a two-stage system, keeping the level low and then directing a lot of hydroxyls just before those fans open to address what's going out.
So, but if you're looking at, for example, your last comment, you're using in rendering plants. Rendering plants are usually in an industrial area, not near residential. So how far away have you ever tried to test how far away, if you're actually capturing those odors or if they're escaping?
Well, we're eliminating to their satisfaction that the odors exist within their boundaries. So, and that boundary can vary, but we're concerned about eliminating the odor in all the cases. That's the goal.
That's the goal, but I guess you can't really quantify that if you move a quarter mile away, if those odors have sort of been able to carry across through the wind or not, because you've been able to resolve the problem on site.
Right.
And because whether it's a cruise ship or a rendering plant,
right.
They're fairly isolated areas, so they're not adjacent to a residential area.
Right. We anticipate eliminating that odor problem on Route 82 at the front of the property in this case.
Right, and 82 is the highway, so someone traveling along the highway may even currently now exhibit some sort of smell, but it's such a brief period of time because you're traveling 50 miles an hour.
Right.
So I think for me, it's not a question of resolving an issue of Highway 82, but it's an issue in terms of how this may or may not resolve the issue in a residential area.
The testing protocol that we've established with Derek is that we're going to be measuring VOCs inside of the greenhouse and then at 5-foot increments at the point of the exhaust fan out. And it's a very quantifiable measure, and you can see if there are any active VOCs as you take these measurements.
And it will take about 3 weeks for the equipment to arrive and then to get set up.
For the first unit,
yes.
It's about 2 weeks, and then we'll be installing for a week.
Installing for a week, so it's about 3 or 4 weeks, and maybe a month before we even know if it's successful or not.
You were up and running by the 27th.
Yeah, we're talking about that first week in September, actually, right?
Yeah, for operating.
So about 3 weeks before you even know whether it's going to be successful.
Yeah.
Yeah.
Turns on in 3 weeks.
Patty?
So, but it's my understanding, though, that the goal is with this new system, that the VOCs will be negated at the point of exit. It's in the process itself. And I think that's probably the systems that you design for whatever use, is that it's contained within this parameter with the system so that there is no escape. That's the goal. So then we could look for any other opportunities if we still had an issue with the doors or any other things that we may need to negate or remediate at that point. And as far as the installation, you're going to install by the 27th. 2 weeks to get 2 weeks to get it, 1 week to install it. So we're 3 weeks out from today for the first system to get that in. And then once that system is up and running and tested, then the other ones will be completed in wherever your plant is and brought back here for installation.
3 weeks.
Correct. Okay.
On site in 3 weeks.
Thank you.
One more question for you, Jordan. Is there any operational change you could make in the interim for the houses that didn't have the hydroxyl unit that could help mitigate odor from those temporarily? And what I'm thinking of is keeping the louvers shut, not letting any sunlight in, just using grow lights where you can maybe more closely control the temperature in there and not have to ventilate them so much. Is that a possibility?
It certainly is a possibility. I'd have to really think it through and talk it through before I understand really what that would entail and
just
how we
treating it as a warehouse, not a greenhouse, so not letting any sun in to a couple of the greenhouses that have plants in them that don't have the hydroxyl unit.
I don't understand that question.
Just to control have less heat so you don't have to ventilate them so much. At least
I think he's talking about how do you control the odor in the other greenhouse.
No, how do you control the heat? I'm thinking of keeping the heat down so you don't have to ventilate it so much.
Yes, and that's, I mean, without the full information I need to answer, I think it seems like that is something that, you know, potentially could be done for the few weeks if we have to do that. I'd need to check with, you know, with the folks who are running the operation on a day-to-day and really understand that a little bit better. But, you know, as I said, in preparation for this, we've tried to put most of the problem into one house. And so we can really, you know, that we can deal with that immediately. And I think what we're going to find is in the remaining two houses, the other thing about, you know, the vapor system is that you can balance the amount that's going in and how it's being used, but you have to kind of find the least common denominator for all the houses. So if we eliminate the worst house, our chances of finding that balance point is going to be a lot greater as well. So I think that we're going to be able to operate it much more efficiently in that period of time, because we're only going to be, you know, having to work on the two houses as opposed to the three. But we're, you know, I'm willing to, you know, take any steps to, you know, to continue to improve the situation.
Okay. And one more question for Derek. Do you have any off-the-shelf units that you have sitting that would treat, or a couple of them in one greenhouse that would work on the air in there and be of sufficient volume to make a difference in?
Not of sufficient volume. It's a huge area and a huge flow, cubic feet per minute out that spans when they exhaust. And that's part of the engineering.
John, I realize that's why you're getting the big engineered units.
Correct.
But if you got 5 small off-the-shelf things and put them in a greenhouse, would that make any difference?
Based on our calculations, we wouldn't be effective that way.
Okay.
Even in combination with the vapor system still working?
When we did the calculations, we didn't look at that, but the problem there we foresee is that the hydrolyzers are going to want to go after the vapor.
Mm-hmm.
It's an organic.
Mm-hmm. Yeah.
So
Competing
it's not,
odors.
it doesn't know what it's going to.
Okay. Any further questions from the board for the operators of the system? Okay, members of the public, if you could raise your hand, those wishing to speak. I just want to get a count to see how many want to speak so we can kind of judge our time. 7, 8. I can see 8 hands, so maybe 8 or 10 people, probably.
More like 10, 12.
10, 12.
What I'm thinking is, if you can keep your comments as brief as possible if we do a 3-minute time limit, could use a half an hour right now, which is already past our time. So keep your comments as brief as possible, even to 2 minutes apiece, because we need to allow time to let the BOCC discuss based on what we hear from you. So when I call on you, if you could maybe come forward some, so you're closer to the mics up here, so that they could be picked up by grassroots, and then state your name real clearly for the record.
They can use my mic over here.
Okay, we could hand that around.
Well, just leave it there.
Or leave it right there. Okay. Raise your hands again for speaking. Have you come first?
Thank you very much. My name is Ted DeWeese. My wife and I, Bonnie, have a home on Bishop Drive. We've had that since November. By way of introduction, I also live in Baltimore, Maryland. I'm a professor and chairman of the Department of Radiation Oncology and Oncology at Johns Hopkins University. I've also been a faculty member long-term in the Department of Environmental Health Sciences in the Johns Hopkins University School of Public Health. My specific expertise is around chronic exposures to various substances. I am not a chemical toxicologist, but as it relates primarily to mammalian cell injury, driving DNA injury, cancer, and other long-term chronic effects, including the 70th anniversary. I'm a part of the National Academy that goes to Hiroshima and Nagasaki, thinking about the 70-year exposure history of those individuals and what that really portends for long-term health. So a couple 3 points. Number one, the terpenes that you've heard about, indeed as reflected by Jordan, who I have the pleasure of meeting, are exactly as he's described these. If you remember from your chemistry, those hexagonal little structures, that gives those fragrances to many things, including, as he described, from lemon, limonelle. What's really quite known, and again, as I said, it's oxidative injuries, that's my most important expertise. When those things are oxidized, and hydroxyl radical, as you just heard from this other gentleman from my great state of Maryland, is an OH compound, oxygen, hydrogen, very reactive, so it wants to react with many things, including DNA, to injure DNA, causing mutation. The other thing it's done, and well reported in the literature, in limonelle in particular, which is at the base of many fragrances to which we are all exposed, it will oxidize limonelle. And in patients who have a history of basal small amounts of dermatitis will drive an allergic reaction. That's very well established, contact dermatitis in particular. For patients who also have, or people who have baseline what's termed chronic odor intolerance, when those people are exposed to oxidized limonelle or other oxidized aromatic compounds, they tend to have reactive oxygen into their reactive airways, and they get a reactive airways disease. Primarily doesn't happen to people who have no history of respiratory illness, like asthma, COPD, things like that. So when you take a community like Holland Hills, which is why my wife and I purchased that home, because it is a mixed community. You have like the beautiful little children running around, you have the more mature individuals, and those are the people who are at the highest risk for that type of exposure. So that's number one. Second major point is that when you think about THC levels, and you think about the chronic exposure to THC, that has a number of endpoints that we won't discuss here. But it's pretty well established, right? The greater the odor, which is from the terpenes, the greater the THC level. Those go hand in hand. Typically, that's primarily out of the Netherlands and out of the UK. So you can imagine that the greater the exposure, the greater the THC level. So I don't know anything about what has been done to measure THC levels in this community. Last point is, we had the pleasure of purchasing this home in this community. I'm a native Coloradoan, born and raised here, college here, medical school here, until I moved to Baltimore. I would have never purchased this home knowing what we know now. We bought it in November. We've been back several times, and now here we are, my first trip back, or third trip back, but since the growing's going on. And you know, this is reminiscent, the logic that Jordan put forward to sort of blame the community in some ways. It's very reminiscent of what we have been exposed to when you think about what goes on in high mercury levels in the Chesapeake Bay, what goes on in cigarette restitution funds, with which I'm quite well familiar. That logic, it runs a little afoul to those of us who have to be there. And to suggest perhaps that a large investment has been made, which I have no doubt has been true. What about our large investment? A large chunk of my income has gone to this, probably greater in proportion than this business. So I would implore the commission today to really think about not just the odor, but to suggest that somehow you've neutralized the, quote, bad odor and made another bad odor. Somehow that's better? That seems illogical to me. You're replacing one odor with another. And be very careful about hydroxyl-based oxidation, because remember, those compounds don't just go away. They've been reacted with hydroxyl radicals, and now they're oxidized. The smell may go away because the bonds have been broken, as you've just heard, but the compound exists, and it's floating around. Thank you very much.
Thank you.
I'm going to call for a point of order. We are not going to do applause or booing and hissing. This is a public comment period, and that's just not appropriate, I don't think. Plus, Steve, I'd ask of you to keep people to their time.
Yeah.
We really want to provide the opportunity for everybody to speak, so we hear from everybody, and we're already running over. So, because I want to hear a little bit from everybody who wants to speak. I think that's important.
Thank you, Patty.
So please hold us to that.
Okay, next person.
Just quickly squeeze through here. Stephan Isberian. First thing I'd like to say is that Mr. Lewis, I think, misunderstood the one complaint we made about our store. and this was months and months ago, that we found a tremendous odor there. And if he continues checking down there, he's not gonna find any, because I haven't found it myself, and I'm not complaining about our store, which he says is a mile away. But the problem is in Holland Hills, and I own 3 pieces of property there. I have a tremendous investment there, and therefore I'm a real concerned homeowner. We never had an odor there until this operation fired up. Whether there's other grow facilities around there, I don't think anybody's gonna tell you that it was obnoxious or that it drove them to what we're seeing here. That's, I think, just a blanket to cover up what the real problem is. I don't see any improvement since the last time we got together. This gentleman is saying that things are mitigated, and it looks like after this next episode of mitigation for the smell, that it's gonna be going, it'll be gone. Well, to me, it's as bad and sometimes worse than it had been. And it's even up till today. We're driving by this morning twice, smelled it. They have consciously sent out these odor detector groups, and we think that's very laudable. They've been in front of my store. I don't know why, because there's nobody complaining down in my store or that area about the odor. And they appear at different places in the subdivision, and I've interviewed them too. And I've heard them say, oh, my machine doesn't work today. It's not working. So what are you doing there if it doesn't work? And why doesn't it work if you're there to do a job? And it's ironic that they're there measuring the smell when there is no smell. Why don't you go when they're dispersing that smell? We know, they know when that smell is being emitted. Why don't you just send the crew over there? Now, can you smell it? And are you around here? I think that's really the crucial thing. I think that they were given the opportunity. I don't see any improvement, and you know, I just hope that we can resolve it. We don't want them out of business unless that they're not going to alleviate that problem. Thank you.
Thank you. Next.
Well, my name is Todd Emerson. I'm also a resident in Holland Hills. Been my observation since the last meeting that the smell really has not been mitigated. I don't understand or see where one could draw a conclusion that it has been eliminated. If their elimination method is to spray something that smells nearly identical off onto Highway 82, I find it not acceptable and not a solution. Again, I don't want these people out of business. I have no reason to. The smell has not gone away. It continues to affect our livability and lifestyle. The smell is very strong near the entrance to Holland Hills. The further you get away from that, the Mountain High, whatever it's called, facility, the less I seem to smell it. It is a clear and present and ongoing odor. Is it dangerous? I have no idea. Do I know anything about the scientific things that have been discussed? I have no idea. I do know that it affects our standard of living, our lifestyle in the neighborhood. It continues to be strong. It is strongest when it's hot. Common sense says that has more to do with the greenhouse is venting more air out. I don't know if the new system will work. I know what they have done has not, and I know that they 60 days ago said they would have it solved by now, and they have not. I would encourage the commission to please take into account the people that live in the neighborhood. Treat us the same as you treated the people in the Woody Creek neighborhood where you didn't give someone a permit. This is no different, except that there are a lot more residential county voters in this neighborhood. Thank you.
Thank you.
My name is Kent Schuler. I've lived in Holland Hills for probably 35, 36 years. So what I've heard today, and by the way, my wife who couldn't be here wrote a letter, and appreciate your comments. She writes a lot better than I do. What I've heard here today is nothing more than more rhetoric about kicking the can down the road, and we're in the can. And it's enough that the summer has cost us, but I concur, my wife has some health issues now, we're just starting to explore those things, and I don't know what it is yet, but it's not good, and that's why she wrote that letter. Because this is very important. Not only Colorado clean air that we're accustomed to, and that's one of the reasons we lived and moved here, is that to have in a residential and resort community something as foreign as this has turned out to be, which I don't think anybody, including the owners, realized. We're hearing today about more development, more waiting period, and this has been going on since February, which we didn't know about. It would have been courtesy to let us know what we were in for at that time. I didn't hear anything about it. Even the Roaring Fork Club has horns that go off when electricity from storms are coming through. It'd be nice to have a horn from them to say, batten down, here comes another blast. Let's have some cooperation, not a website that we can't relate to. Another block that could have been positive. It's just an example, I think, of where this is going, nowhere. There's nothing wrong with closing it down for a year and see if it makes a difference, or longer. Then we'll know if the other issues we're getting to pointing the finger around here today, if that has anything to do with anything. Let's see. The summer has cost us. I bought a new barbecue this spring thinking that meant something. I used it twice. I can't count on being outside. At night when we go out to dinner, if our windows are open and it gets trapped inside, we spend hours trying to blow it out. It gets in our hair or clothes. Enough of this nonsense. It's just time to stop. Thank you.
Thanks, Kent.
My name is Chris Cox. I live in the neighborhood. I live on Hoagland Ranch Road. To me, this is pollution going into our environment every day by a company. If this company was polluting a river that we could see, it would be shut down. If it was noise that we could hear, it would be shut down. We have evidence. We have dozens of people here that are testifying about this, that the quality of life, their investment, every day is affected. I want to know why we're not talking about shutting them down until it's resolved, until they can prove that they can have an odorless business. That's all I have to say.
Thanks, Chris. We
Thank
got
you.
one more behind the pole over here. Can I point him out
Okay,
since
yeah,
he's
thanks,
hiding?
Patty. I couldn't see.
Hi, my name is Greg DeRosa. I'm the General Manager and Chief Operating Officer of the Roaring Fork Club. I represent the owners, over 525 members, over 165 property owners, and a couple $100 million asset that sits on 375 acres, both on the north and south side of the river, basically wrapping around the facility. And I'm here to just convey that I get constant complaints from our members. I get queries from guests. What is that smell? We have an operation down by the river called the River Cabin, which is a food and beverage operation that we're open for lunch 7 days of the week. We also do special events, and we often have that smell, which is directly west of the facility. And I would request, as the rest of us here have requested today, that this be shut down until it can comply with the original terms of its operating agreement. Thank you.
Hi. Tim Poole. Yes, I've been a resident in Holland Hills for quite some time. I guess my question is to the commissioners themselves, when you read the mission statement of your own website and how this development is going to better the communities moving forwards for generations to come. I think that's something that each and every one of you needs to answer and then rule accordingly.
I'm Bonnie DeWeese, and my question is, one, when these units break down, if it takes 3 weeks to get a new units, how long does it take to repair units? And then are we, if they're in full bloom now, are you having these emissions unchecked as well. Also, it seems to me there's a lot of unknown. We used to not know that secondhand smoke was a danger, but we now know that. What do we not know about this? Is there some health issues? Smell is one thing, which I understand that's what everybody's talking about, but what about the other costs that you don't know? Do we want to be guinea pigs to that?
Thank you. Yes.
Hi. I'm not very good at standing. I'm going to come over here. I'm Bronwyn Anglin, and I live in Holland Hills. We moved in June 2000 when my daughter was 6 weeks old. My big investment in this community has been raising my daughter for the last 15 years. It's been a brutal summer for us. You all know that I have called you personally on more than one occasion to complain about the air quality outside my house. Our townhome was built in 1970. It has no air conditioning, which means that in the summertime we need to have our windows open to cool our house. I've heard what I think is a lot of red herrings about these other grow operations, or even it was mentioned in the newspaper, the kennel makes more complaints than this. I live right next to the kennel. I'm the closest property to the kennel. I've never heard a complaint about the kennel. I think red herrings are being thrown out left, right, and centre. What we do know is before they started operating this greenhouse or farm, there were no complaints. If you look in the room today, you've got the entire subdivision represented, from one length of the subdivision to the other. It's not just a tiny little area down on Highway 82. I want you guys to look at how many Holland Hills residents are here asking you to please do something about this. We haven't been able to enjoy our summer. I know that levels of THC in developing brains cause, it's widely documented, that levels of THC in brains younger than 16 years old cause lifelong irreparable harm. My daughter's 15. We've put up with this for months now. I ask you, please, listen to these other people and consider shutting this down until they can demonstrably, without a shadow of a doubt, prove that this isn't causing harm to us. Thank you.
Hi, I'm Carol Riley, and I've lived in Holland Hills for about 29 years. And this summer, I have worked from home most days, so I'm around during the day most of the week. And I notice the smell just about every day, starting June through the last few days of August. I know that Kurt had done, he had a list of the odor chart that he'd done, and I cross-checked that with the Roaring Fork Smell website and found there were probably about 22 days that Kurt either didn't check it or that he didn't notice an odor, and those were days then that some of us in Holland Hills had posted that there was a very strong smell. So I wouldn't rely just on the odor check that Kurt has done. I don't think that it gives you a full picture there. I feel like it's been very frustrating. This is a material nuisance to us being able to enjoy our time in Holland Hills. The other day, we couldn't even eat dinner outside on the deck. We're in the second row of Holland Hills homes, so we're right behind, there's one house in front of us and then the highway, so we're 2 rows back, and it's a very strong smell most days. We could not even sit outside on our deck and have dinner the other night at 6 o'clock. And now, listening to some of my neighbors, my new, I think, next door neighbor talking about, from Johns Hopkins, talking about the potential effects that we don't even know about, I am scared. And does anybody want to buy my house today? I mean, I'm really worried about what we don't know about this whole situation and what could be coming down the pike that's going to affect us in an even bigger way than the smell does. And I ask the commissioners to do a little more research about this next mitigation hydroxyl cure that they supposedly have. I prefer to have the whole thing shut down because I don't think it was built in the right place in the first place. It should be out where there are no residential areas. I mean, we have over 70 households affected in Holland Hills. And it should not be put in that kind of a location. It should be like in Glenwood Springs where it's all in a more of an industrial neighborhood. This is not the correct place to have it, and I think it's time to acknowledge that, shut it down, and let's get our lives back for those of us who live in that neighborhood. Thank you.
Thank you.
I think David Lambert.
David.
Yeah, I'm David Lambert. I've lived in Holland Hills since 1976. I think the other neighbors have really expressed my feelings. I don't really need to add any more to that, except that I have been a general contractor in the valley since 1976, and I have been red tagged twice for causing dust at a job site by one complaining next door neighbor the same day, and we fixed that. We started watering the dust coming from the drilling equipment, but I just wonder why we're being treated any differently than any other business in this, especially in construction in this county, or being treated or will be treated. Is just it's like we're being ignored. Thank you.
Thank you. Is there anybody else who wishes to speak at this time? And this will be your last chance for now, because we have to move on. Nancy.
Nancy Booth. I ask that the farm be shut down. It's affecting my health, and it's not gotten any better, and it won't get any better.
Just, is there any other further
I have one.
comments from the public, from the members of the public?
I'm Robert Hildebrand. I live about as far away in Holland Hills as you can get from the pot farm. I'm shutting up. The doctor here, I'm on oxygen generators already, and my air is going to hell because I can smell that pot plant clear up on the very top of the hill. So let's get rid of it. It wasn't good enough for Woody Creek. We don't have as much money, but it's not good for us.
Okay, Jordan?
I would just ask the commissioners to exercise some diligence in some of the comments that were made, especially from the gentleman from Johns Hopkins. I mean, we've got two other folks sitting here with significant experience, and the fact is I've never heard or seen of any studies that shows that THC is airborne. And hydroxyl is UL approved for use in close confines, and I think Derek can speak to that. So I understand that, you know, the concerns he's raising, but I think that they're more inflammatory than fact-based in nature. And rather than take it at face value, I think that we need to look at the facts here, that this equipment has gone through all of the federal testing required to be considered safe to use. And, you know, what we're hearing is in my view, just speculative and inflammatory, and there's really no scientific basis that I'm aware of. And certainly as far as THC being airborne, I've never, ever heard that, period. And I can tell you from years of experience working around these plants, it does not get into your system through the air.
Okay, thanks, Jordan. Let's see. Okay, I'm going to bring it back to the board now. Thank you, everybody, for your comments. If you have any further comments, send your emails. We're running way behind our schedule, and we have more issues we have to still deal with today, and the board needs to discuss this right now. So send us emails. We all read the emails. We do get them, and we have been reading them. I can guarantee you that. George.
So we have a simply stated charge, but it's much more complex when we actually have to try to put that into place. And that is, our charge is to protect the health, safety, and welfare of our citizens. And so what we've heard today is the odor is is not only a nuisance, but it's a health issue for some people. If you're on oxygen or if you're highly sensitive to certain odors, it impacts one's health. As one or two comments were made, if we have an issue with dust, we have ways to address that. And we require that there's dust mitigation, and we don't allow that to continue because we know that's going to affect the air quality in this near residential area, it's going to impact those residents. If this was a bar, and they had loud music, and they went beyond the time frame when the decibel level was high enough, that was going to impact the noise level, we have mitigation for that. You know, we don't allow that to continue. We shut that down until they're able to resolve that issue. So we've had since June 9th to try to resolve an issue of odor. And I know, and I'll give credit to the owners, that they are trying to work towards this, first through a mist system, then through a dry vapor system, and now through this next system that's going to be coming online. But in each case, it hasn't actually worked. And so we have really no guarantees that this is going to actually resolve the problem. It may lower the odor issue. It may substitute one odor for another odor, but we have no guarantees that it's actually going to resolve the issue. And it probably won't. I mean, this has been an experiment since the very beginning, and I've always argued against it because it was an experiment, because I've always felt that this type of facility should be in an industrial commercial area versus a residential area. But I lost that vote. However, you know, two wrongs don't make a right. In the previous board that first approved this grow site and approved the size of the grow site, the board has changed a little bit in composition. And so there's an opportunity to correct the situation now. I would suggest that we suspend this operation. That will do two things. First, it will allow us the opportunity to actually see if there are odors generating from other areas that are impacting the residents. We can better identify and isolate perhaps those other homes that are using grow sites. So there's one opportunity. The other opportunity is to then allow the time to perhaps see if this hydroxyl system can be used as an experiment. I don't know where else, but there must be another place, perhaps on the Front Range, where there are some very large grow sites, to see how successful they are. But I think we have one business here. We have over 70 homes and families that are impacting hundreds of people, and it just isn't right. We're just not addressing, I think, our charge. And our charge, again, is to protect the health, safety, and welfare of our citizens. And I just don't see how, by continuing to allow this operation to move forward and to continue to experiment using one technological system to another until they hit on a system that will actually work, continues to impact our residents and our citizens. So I would suggest to the board, at least, minimum, suspend these operations and then go from there.
Rachel?
Yeah, I've, along with a lot of the board, I'm sure I've been giving this a lot of thought. And it is really challenging. And I will acknowledge, Jordan, and Mike, your efforts and your sincerity in this effort. And I may repeat some of the comments I made at the last meeting in one form or another, but there were commitments that were part of the special use permit. There were conditions that you made assurances to us. And we took those assurances on face value and made the assurances back to the neighbors that this will not disrupt your quality of life. This will not affect your community character. This is going to be a very attractively built facility, which it is, and it is appropriate ag land for that type of operation. But what I would see as the primary commitment has been the one that has been unfulfilled. I mean, I want to make sure it's on the record. We haven't had, any of the criminal activity. We haven't had the undue traffic. You've built a nice-looking facility. There's no question about that. But the odor is something that it's really hard to ignore. And my boyfriend was coming up Valley from a meeting on Thursday, and I said, "Did you smell it?" And he goes, "Yeah, you always smell it, when you drive up Valley." And when I drive down Valley for my meetings, I certainly have noticed it. And there's some days you don't. And some people who've written us have said, "Hey, there's some days you don't notice it at all." But I have to think as a homeowner myself about what that means, to even have it on the back of your mind that you're driving home, will I smell it tonight or not? It creates a certain anxiety about your day-to-day life that shouldn't exist. And, I live in a condo complex, and you get used to it. I remember when Margaret Wong always had the great Chinese food upstairs, and I come home and I ate it, and I can tell who's barbecuing a steak one night and who's burnt the toast. And that's one thing, but to have this within your house, it's just untenable. It really is. And this has been a hard conclusion for me to come to, because we all know the background. We also, 70% of Pickens County vote for legalization of marijuana. And we've all known that we're on the cusp of some changes and innovation. And I've said it before, I'd say it again, I'm glad to not see this industry underground and feeding the black market and putting money, God knows where, into the system. And this is a change. There were very clear differences in terms of what we supported and didn't support in Woody Creek and here. And one of the biggest considerations at that time really was the proximity to police and security and safety and fire and things like that. We did not hear negative comments from the Basalt Commission and the town of Basalt within their planning area and things like that. So I do want to say there's no apples to apples in looking at why someone came up or why one went down. But we did thankfully cut back the original size and number of greenhouses you wanted, and that still really just hasn't seemed to be sufficient, And when we had our last meeting, we've been aware of this problem. It's a growing problem. We've tried to look as a board at what is the best way to structure this, and that's why we had an earlier meeting, so you'd be somewhat put on notice that these concerns were just out there and growing and not going away. And I look at this as still somewhat of an intermediate step before that license is expiring on September 24th. And so perhaps a little bit similar to you, George, but not exactly the same path. I think that it would be most appropriate to give these guys the heads up that there won't be a renewal of that license, and to have this next 6-week period for them to have a closeout plan and figure out how to shut it down. I don't see suspending the license, and what does that mean? Please burn all your plants tomorrow, or cut them and deliver them somewhere tomorrow. Or, what does suspended mean in terms of someone being able to go in and close it and things like that? So I would think more along the lines of that it would not be a licensed facility after the 24th, that this next time period is something that I'm not going to make the decisions for you. It's a very complicated thing. Should they go forward and install this system and be able to make a great case that the one greenhouse that you have left, that you have growing, you have things in, it has the system and it's working. And on the same room full of people will tell you they're not smelling anything at that time period. I mean, I suggested at the last meeting you should radically reduce the number of plants, do something to get rid of the odor in the meantime. And that just hasn't happened. And so that's a little more of my train of thought. I welcome other board comments and information, but if you've made a mistake and it's not working out, it's not something I'm going to stand by it forever. And
Just asking for the opportunity to fix it.
I understand that, but it's how many opportunities happen. And I'm sitting here trying to think of some analogies. Baseball, 3 strikes, you're out. You're right, you had 2 strikes. 2 systems didn't work. Could the 3rd system work in time for us to hear that for a license renewal hearing on September 24th? You have a lot of bridges to build if that's the case.
But we're 5 months into the process. We're almost at the finish line.
I know, that's why I'm not suggesting immediate suspension of your current license. But I'm thinking that pardon, please, we're not having a debate. What I'm thinking is that September 24th is the real drop dead. There's either a permit that's renewed or a permit that's not renewed and it's closing. And that would give you time to think about a closeout plan and how you're going to deal with that. And it would also, if you do go forward and install this system by the 24th and can bring it down to 1 greenhouse that has no odor whatsoever and can make that case to both the neighbors and the feedback we get from the neighbors and this board, then maybe there would be an opportunity for renew. But as it stands right now, I can't see it. I certainly could not renew the operation we have in front of us today. And again, I'm acknowledging your best efforts, but I would not move to immediate suspension, and I'm sorry if that disappoints the neighbors. I'm also, but I am willing to not renew that license if we haven't seen the full corrective action and the full original compliance with the terms. Because we put our trust in you, and we extended our goodwill and our trust to the neighbors and asked them to support our decision and to live with our decision. And we've asked them to live with too much when it comes to what those results have been. And we take the blame for that. But it's not a relationship I would continue if these problems were to persist.
Steve, I just want to clarify something procedurally. So today is a work session. The board could not actually suspend the permit here today. They would need to refer this to the hearing officer for a hearing on a violation. And after the hearing officer determined a violation occurred, then the board in turn could suspend or revoke or take any action. But just to clarify exactly what can happen today by the board.
And so the violation, at least in my mind, would be that they haven't come up to the licensing agreement in terms of the original license, which was to address many different factors, but certainly odor was one of those factors.
Yeah, there's language in the code that requires that there be no negative material odor effects, and so the hearing officer would have a hearing on that and determine whether or not there was a violation of that. And if the hearing officer found that there was a violation of that particular provision, then the board could take any action they wanted as far as revocation, suspension, partial revocation or suspension, anything of that nature.
Okay, first of all, I'm the new character on the board with the change of board character. I was not part of the original approval. I read the information. Of course, I followed it like the rest of the community did, followed it very carefully. I agree with the neighbors. I mean, I've had to live in my neighborhood with issues. I'm living with one now that I can't seem to get the city to address. It's interfering with my quality of life, and I can totally relate to that. I think in this case, I think like George said with red tagging for dust or noise, that's easily quantitative, qualitative. We have meters, we have dust meters, we have all of that. It's very specific. It's very easily mitigated. You turn off the noise or you water the dust. I think in this case, it's like Rachel said, it's very complex. There's a lot of moving parts to this. I agree with Rachel on the deadline for the review of the current licensing. I believe that the owners will put his money where his mouth is and resolve this problem, and if it's not resolved, then we address that prior to any renewal of the license. I think that's critical to the neighbors. We do not want you spending another year of your lives with your windows closed and not being able to use your new barbecue and enjoy your investment in your property and your quality of life. I also, on the other hand, I'm not pointing fingers. I'm not trying to say that he's not the only one contributing to the odors in that neighborhood. I don't know what the county's provisions might be. I think we need to look into other legal or illegal grow operations in that stretch of road, because you can smell it from Emma all the way up to Aspen Village on some days. You know, there is an odor. I mean, drive through the Denver neighborhoods, you smell it just about everywhere. I think that that's something the county needs to talk about at another work session on what opportunities we might have to look at those other operations that are in the neighborhood. If we're going to fix the problem, we're going to fix the problem. We're not going to just say this one's done now, we have 25 other ones we need to deal with. Let's look at this whole thing comprehensively and then make a decision. So I think we need to allow the next phase, the hydroxyl system, and if it's not done, we're giving the onus back on the owner and the operators. By the time of the renewal of the license, then the board will discuss it. Seriously, discuss it.
George has his
George?
I was just going to mention to the board, just a reminder, when we had our last meeting here June 9th, we set a time frame of 60 days, which the applicant said, we'll have this addressed within 60 days.
I did not say that, George.
George, as I recall it, it was that the second system would be in place, but meanwhile, they were ordering the parts and having the engineering done on this third system that's not actually in place. So that if the second didn't work, they already were working on the third.
Okay, so we know the second didn't work.
Correct.
And now we're being optimistic that the third system will work.
I'm not sure I'm being optimistic, but I'm letting the clock run out till the September 24th date of the current license. That's what I would suggest. And as I suggested before, you might need more than one system. You know, it may not be that a single system can deal with it. But, you know, again, that's your call as to whether to go forward with that expense or not. And you know, at some level, we all know there's got to be, you know, price of land and $1 million or more you've invested in that, and that doesn't rest easy to cut someone of that. But as I said at the previous meeting, we have, you know, equal to greater individual investments that have to be weighed. And so I know your efforts have been sincere, but if it doesn't deliver, it doesn't deliver, and if it doesn't fit, it doesn't fit.
First of all, I would like to apologize to all the residents and to Jordan and Mike. I think the county did a disservice in approving what we did approve at the time. I know we cut it down. I wish we had cut the size of the operation at least in half from what we approved. Have 2 greenhouses now. You would be in a better position now to have a less odor problem and less damage if you didn't get renewed. The neighbors would have automatically had less odor going out into the neighborhood, and everybody would have been better off. So, you know, hindsight is hindsight. It did get approved. My feeling is, and you maybe got my drift when I was putting some suggestions out there, was how can we make this work in the remaining 5 or 6 weeks that are left on your 1-year permit at this point. I'm willing, if they could get rid of the odor in the last 5 or 6 weeks, which potentially they could by changing your method of operation in the units without the hydroxyl thing, get the hydroxyl unit in the one greenhouse and see. That's the only way we're going to find out how it works, is to get it in there and see how it works. And it might it might work fine. Dave Lambert told how he used a little unit in a house that had cat urine smell permeating the whole house, and he got rid of it in a few days. So I think these units are, you know, if it can do that, it's, you know, has really good potential to solve this whole problem.
So you're not telling them to run a cat shelter there?
No, that would be worse in my mind. At this point, I would not do approval of the full operation on September 24th. I would maybe approve two greenhouses at the absolute most, but maybe just one greenhouse to see how this unit works and to make sure everything is ironed out. And if there were no odors or very minimal odors coming out of the greenhouse, out of one greenhouse operating, then we could consider something more. And if there were odors that were, in the words of the thing, material that they cannot materially interfere with the enjoyment of adjoining property, and if they were still interfering with the neighbors, the thing would never be expanded and then would not be renewed. So that is as far as I would go. But I'm willing to give the business another till the end of the September 24th date and see what they can do with the one unit. If we went to the process of doing the hearing officer, it's going to probably take a whole month to play out anyhow, given public noticing requirements and all of that. So that's kind of the timeline that we're on anyhow in terms of the renewal for the coming year. George?
Well, if we suspended it, we wouldn't have to worry about that. But the standard should be that it's not less odor. The standard has to be no odor. And the standard can't be, well, we'll just cut the size of the grow site by half or by a third because it's less odor. The standard has to be, we do not renew that license if there's any odor. Because any little odor is going to impact the residents. If you had a skunk living under your deck, what would you do? Would you just live with it, or would you remove it? I would suggest that you would remove it. The residents of Holland Hill are asking us to remove it.
Are we finished here?
So,
Do you have any direction for staff at this time?
See, I have a suggestion. I think the board has all spoken about their opinions about where this needs to go forward, and hopefully made that clear to the license holder and to the neighborhood of finishing this out. I think the most important thing would perhaps be a memo about what is the transition of a facility that is no longer licensed. You know, how do you decommission if that's where it goes? And again, I can't make the business decision for you guys. Do you go forward and decide to try this system and see if you get to that zero odor point on one active greenhouse and can prove that to the board? Or whether you say it's not worth the investment in hydroxyl system because it probably won't really get us there, and we'd rather have an orderly close of the facility in 6 weeks. So I guess that's the step that we've never been through before, and probably half the state hasn't been through before. But that may be where we're going. That's about the only real direction I can offer right now. And the other might be consideration of how does that September 24th date mesh with our regular meetings. We have a regular on the 23rd. That would be calling it really close if they're then going to go into a closeout plan. I don't know what that would be. If there is, it's the permit renewal is denied, but could there be an extension for 10 days that they can clear the stuff out of the facility?
Yeah, we have to find out
Or
about
how
that.
does that happen?
There is language that allows, when a renewal application is pending, for 30 additional days.
So that if a decision was made
There's a-
though already by the board, these guys wouldn't, it's not like we put a lock on the front door and police orders or something. There has to be an orderly decommissioning, if that's where it goes.
Jordan has a comment.
Jordan?
I hear the conversation, and what I'd like to reiterate to the board is we're going to fix this problem, and I ask that the board set it up in such a way that we can take objective data, because quite frankly, my concern is that even if we didn't have a single marijuana plant in that facility, we would still be getting complaints. And complaints.
Okay.
And we are going to do everything possible on, to get to where we need to get to by the licensing hearing. We have this timeline. We've come so far. There is so much at stake as far as, people's livelihood in the community and so much else. I just respectfully ask the board, could we structure, the evaluation period in such a way that we can evaluate, and we will take steps in the meantime. Obviously, we don't want to expose ourselves to that, but can we take steps in the meantime to look at this fair and objectively? I think that there is a, for lack of a better word, there's a certain mob mentality which has taken place, and it's.
No. Wait.
I'm sorry.
Boo, sir.
I hear you,
Excuse me?
and I'm entitled to my opinion. And
Hey, excuse me,
Sir,
folks.
you can, if you can't be calm, please.
We will have to remove you from the room if you continue talking.
Yes, sir. Will do.
Thank you.
And I just, my genuine concern is that no matter what we do, and, we've been taking, measurements in the community that don't speak to what we're hearing from the folks. And at some point, I just ask that the board use objective measurements and there's some fair assessment of this. And then I also ask that, given the timeline and given how far we've come, if it's, if we're talking about, 3 weeks to install the additional units, even if we, voluntarily reduce, the size of the grow in the interim, it just, it seems like there's a foregone conclusion that this isn't going to work when we've been, identified from the very beginning that this is our best chance of it working. And it seems like we're not going to even be able to get there.
Steve,
Rachel?
we're all frustrated, Jordan, the audience, us, our staff. It's not quite fair to say it's the best alternative because it wasn't the first system you put in. It's a system you've migrated to over time because the other systems weren't working.
No, they actually had to research and develop the system. It's a whole new system.
Additionally, your request for a fair evaluation, I think, is reasonable, and I think that that's something for us to work with our staff about how we can do a fair evaluation, not from your self-reporting and taking it all and putting it in the mix. Your self-reporting, the neighborhood self-reporting, and if we can find additional measures. I also, we only have so much time at a time like this, but was very interested in asking my staff what they could do to find out where the other 5 grow facilities are from you or from anyone else, and see what we can do to measure that, whether it's a simple nose test or whatever, but we should find out what you've identified as other potential sources of noise, odor contamination. As Patty said, we don't want to just take care of this problem and then have lingering problems in neighboring areas. But I also would like to see a fair evaluation. But I think that you are not, at a certain level, understanding the sincere frustration and aggravation the neighborhood has enjoyed.
I do understand, and that's why I've been working so diligently to find
Jordan,
a solution.
I'm going to cut you off because we're not going to get into a back and forth debate right now. I am concerned about the report of possibly 5 other grow operations. I remember former Commissioner Rob Ittner telling about several doors down from him in the townhome he lives in that somebody was growing marijuana in there, and it was unbearable to him if he would go out the window and in his window. So, you know, a small, in someone's house grow operation can emit a lot of odor, and
We'll do the best we can do.
we have to try to track that down and see, you know, the validity of that claim, Jordan. So, and I think on September 9th, the regular meeting in September, we need to have this on the agenda, because September 23rd to me is too late. It might take us 2 meetings to get through the whole thing here regardless.
The board does have the ability to extend the renewal. Basically, they can extend for an additional 30 days the license to allow you guys time to have a hearing on that renewal license. So we don't have to have action 100% by the 24th.
Okay, so if we did do the meeting on the 23rd, then that would be sufficient given the rules.
We could extend their license by 30 days to allow for any action by the board in that 30 days past the 24th.
Okay.
Be that
So maybe
decommission or
I'd leave it, you know, defer to the staff what
Date.
in terms of the date, the 9th or the 23rd. One or the other, though, we absolutely have to have it.
Well,
And have the resolutions and stuff written up.
Can I ask that you've given the owner time for rebuttal, that no one else has had a chance for any rebuttal?
This isn't a rebuttal type hearing, and I apologize for that. They are the license holder, and so they do have a chance to try to address concerns. I don't agree with all their statements, but this is kind of the process.
Okay. George?
Well, I don't know why, I mean, if this is the road you're going to go down, why wouldn't we just wait till September 23rd when the license is ready to be renewed and they have not mitigated 100% odors? At that point, the board can make a decision. And if the board decides not to renew the license, then there's a 30-day allowance to decommission.
That's what we can decide at that time, yes.
So instead of doing September 9th,
Right.
that doesn't make any sense.
That might go on there. I agree with George.
We will set the hearing and agenda for September 23rd on the hearing on the license application, assuming that we receive that. I don't know if we received it. We have received it.
Okay.
Okay. All right. Thank you, everybody, for your time today. I appreciate everybody coming up here.
Thank you very much. John, before you leave, let's ask you. He's not leaving. No, I know, but, you know, it is 5 o'clock. Do we really need to do the landfill operation change?
our last item we're going to have on the agenda today is an operations change proposed at the county landfill.
I'm Kathy Hall, Solid Waste Manager.
Brian Pettit, Public Works Director.
And Jonah Frank, the Picton County Fleet Manager.
Welcome. So we just wanted to come in and touch base with you. As we recall, to give some history, back in February, we went out to bid, January, we went out to bid for the landfill operations contract, which expires, Heartland currently has that, and it expires in February 2016. So we went through the whole process of an RFP, and we looked at that and came in and benchmarked against our own costs. And in May of this year, you, the board, decided that we should bring the operations in-house. And in June of this year as well, we finalized the formal RFP. So we went forward and we took that and we had a baseline of equipment that we were going to use. So after we formalized us taking it in-house, we sat down and started looking at equipment. And we've made some operational changes that we wanted to bring forward to you to update kind of what we're thinking. So we determined one of the big cost savings and efficiencies we could achieve was by changing the alternative daily cover we use. Currently, right now, we are permitted to use our ground-up construction demolition debris. If you recall back to those conversations, we had a lot of discussion over the grinder. The grinder is an expensive piece of equipment to purchase. It would have been about $600,000. The operations and maintenance on that grinder is heavy. I mean, it's an expensive piece of equipment to operate and to fuel. There's health and safety concerns with it, and we have some potential air quality issues. So we stepped back and looked at it, and we looked around at what other people were using. A popular use for alternative daily cover is a spray-on alternative daily cover. There's two major brands called Posi Shell or Top Coat. And it's simply taking a hydroseeder unit, 1,000-gallon hydroseeder unit, the same ones you see on the roadside seating roadsides, and it's a bagged fibrous material. You put it into the hopper of the hydroseeder unit, you add water, and you spray it onto the working face. Currently, right now, we're permitted for the C&D alternative daily cover. We would have to check in with the state. We've already talked to the state about it. It would be a 60-day evaluation process, so we would use the material for 60 days and then report back to them after that 60 days to ensure them that there were no nuisance issues, no odor issues, and it worked just as we said it would. We don't perceive that there will be any issues using that alternative daily cover. So that is a big change, and on the spreadsheet you can see we've highlighted the original budget for the C&D grinder. The bottom table shows the cost savings. There's a significant cost savings by not purchasing the grinder. We would purchase a hydroseeder, which we're estimating at $100,000, which is probably very conservative, high. And working with Summit County, they use the same type of alternative daily cover, the spray-on. It's about a $50,000 a year materials cost. So it's a significant cost savings. We would still be required to cover with daily cover soil 1 night a week. That's part of our permit, and the state will continue with that.
Rachel?
Okay, what do we do with the construction and demolition waste then if we're not grinding it?
Exactly. And so we, in our original bid comparisons when we were going through the bid process, we bid out or had them compare, it's a Caterpillar 816. It weighs about 54,000 pounds. Now airspace is critical and you want to maximize the compaction. We have gone up to a larger compactor, a Caterpillar 826. So to give you a size differential, the 816 is about 54,000 pounds. The 826 is about 94,000 pounds. So we're adding 50,000 pounds of weight and a cost differential of about $250,000. So the savings by not going with a grinder, a larger compactor, and the hydroseeder is pretty significant.
I got the savings, but I still haven't got, instead of grinding and using the waste, you're saying we're going to bury it now.
It'll go in with the regular trash, and we're going to run over it with this larger compactor.
Okay, and is that what we currently break down though and sell as aggregate materials?
No.
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 And so it doesn't affect the aggregate, so it's not really all of the construction waste. Would it be wood material being taken out and ground and compost, or, you know,
No.
really please explain it a little more?
Yeah, all of the construction demolition debris would go in with the trash. We don't separate out the manufactured wood waste for the compost because it's chemically treated, so
Okay.
we remove that from the process.
So soils and aggregate would still go into the soils and aggregate program. The landfilling of the construction demolition debris really doesn't change other than we're not grinding it. It's still going in the same hole with the trash.
But you're compacting it with a heavier piece of equipment, so you're actually crushing it by compacting it, not by grinding it.
Correct.
Correct.
That's right.
Got it.
And then we don't have it for daily cover, so we have to put something over the top.
Right,
So
right.
that's where this other process is involved.
Does that newer level of heavy compaction potentially press more methane out or other materials that have been buried prior in the landfill at different levels?
No, it won't affect
The water testing,
Water,
for the leachate
groundwater,
or anything like
yeah.
that, as far as we know or understand now?
And another bonus of this equipment that we're getting, we're going to outfit it with the GPS unit. So in real time, that operator in the cab will be able to see what his compaction is. And we originally put in the original bid 1,200 pounds per cubic yard. We're really going to shoot for 1,700 pounds per cubic yard.
Yeah.
So,
1,700, is that like PSI, except it's
yeah, it's
per
on
cubic
that.
yard?
Yeah,
Okay.
it's a similar concept.
I have a comment. Because we currently use construction waste by grinding it and using it as a daily cap, we may not always, do we always have enough? Are we always sure we're gonna have enough? By having this other system, we don't need to worry about if we have enough.
Yeah, we've always had enough. I mean,
If we were to
60
see a huge
yeah.
downturn in demolition, we would have to worry. This way, we have the equipment set up, so if we didn't have that daily cover, we have a method of doing a daily cover that's acceptable by the state.
Correct.
Oh, at the end of a 60-day trial, okay.
That's right.
George?
So in your memo, you said that you work with Summit County who uses this at their landfill, and you also say that this spray-on EDC is commonly used on landfills around the state and the country.
Mm-hmm.
So my question is, I'm just wondering how you came up with this, what sort of prompted you at this point to go in this direction?
I was really talking with Summit County after one of our board meetings as we were going through this decision process, and he's like, you know, we've had great success with it. Why don't you look into it? And so,
So at that point, we started pricing it out, and it made economic sense.
Yeah.
It made a lot of sense environmentally because we're really the last entity that's grinding construction demolition debris the way we are, and I think we're probably running up against a deadline for that anyway with the state.
And then we would begin this when we actually take over the operations?
February, correct, yeah.
So we have to go through the permit system and then get the equipment and get everything in place, and it would begin in February.
Correct. And actually, tomorrow, we're working with Heartland on a transition plan. We may be able to try it sooner than that. I would like to be able to hit the ground running in February, so that January, we're working on some of the operational needs in-house.
One other question, and Jonah, you're here because?
Because he likes to come before.
Well, I'll ask
He likes
Jonah
big
a
equipment.
Well, I'm assuming
Jonah
you don't have to.
He's very quiet, he's always very quiet.
Right.
It's one less piece of equipment for us to maintain. That's a very heavy piece, you know, we still have to maintain the hydro seeder, but that's a lot less maintenance than the grinder would be. I'm just here to answer any, comments on the equipment side, if there's any.
We thought there might be some ongoing operation or maintenance questions with the change of equipment. And, when we went through the bid process, our goal was apples to apples and not to consider operating
Innovative.
changes. But we wanted to leave open the opportunity if we saw options like this that we thought could reduce our costs and long-term maintenance while saving or at least no net loss of airspace, that we should be bringing those to you.
Couple questions. How much water does the hydro seeder use, and where are we gonna get that water from?
Well, good question. It's a 1,000-gallon unit. We're estimating about 10,000 square foot of working face that has to be covered 5 nights a week. We are in the process of doing a cutoff trench to capture that leachate issue that's seeping into the stormwater pond. We have to pump out water from that trench. It'll run through a air stripper, which will remove the volatiles. And that water will be containerized. Now, the state has indicated we can use that water for our spray-on ADC mixing as well as dust control up on the landfill. So that's essentially where we're going to get it.
So you don't have to truck it from
Down at Public
town
Works.
or
Yeah.
out from an irrigation ditch somewhere or whatever.
Exactly. So we're going to reuse that water we're going to capture.
Okay, and then
No odor.
if we get the wastewater treatment facility built, then that water would be suitable
That
for
effort,
those.
absolutely.
Okay. Where does the spray-on material come from, and what is it made out of?
It is a fibrous. A lot of times they'll use shredded newspaper, and it's mixed with like a binding unit. So this gets shipped. I think the manufacturing plant is on the East Coast, and according to Summit County, you get a truckload of it. Lasts you about 6 months. He uses for his 1,000-gallon unit 15 bags per each spray. And he's indicated they used to share costs with another landfill in the county. That landfill has since closed. So he's like, we can save money on shipping if we partner on a shipment, if we
With
use the same
Summit
brand
County?
he does. Yeah. So.
Okay. Is there any chance we could manufacture our own from paper products instead of sending the paper products to Denver?
I've never heard of anybody, the actual base product. However, Mesa County uses a Posi Shell, the other brand. They're using latex paint. They're doing a study now. They're excess latex paint to be able to mix, and it gets sprayed on. These systems too, you can, if you had to line a stormwater ditch with concrete, you can put in a Portland cement and spray and line a stormwater ditch. So there's a lot of options. But I've never heard of anybody mixing the base.
Okay. Just
Good thoughts.
curious, my engineering mind at work.
Yeah.
Rachel?
Yeah, well, this seems like a reasonable direction to go to. You know, I don't see any downsides. It does make me wonder, do we really have that 1,000-gallon flow? And you said we do. Through the leachate pond, it regenerates at a rate of about 1,000 gallons a day.
We'll be storing it in a frac tank up on the landfill. So we'll pump out of that trench and it gets stored into a frac tank. So we should be able to have enough. And if we just don't, then we go down to Public Works and pump out.
Okay.
You know.
Well, what is the cost of the frac tank? Is that built into this cost estimate?
Not on this, but we're working on it on the cutoff trench for the remediation. So that'll be part of that remediation system.
Okay.
It's a different project.
Yeah.
Different project that,
And would you'd have some kind of a tank like a frac, and by that you mean the Halliburton?
Yeah,
use
you see the metal.
The big shipping container size box.
That's the plan, yeah.
Okay.
and will that be visible? Where will that be located on the
We're going to put
master
it up
plan?
in the boneyard
So not,
corner, yeah.
okay, visible from the road. And then I guess the other question is, would that, you know, we've seen some joint use from different departments, such as open space and trails with some public works vehicles and so on. Would it be possible to use the hydro seeder dual purpose and use it at some time when they are spraying fertilizer or seed on a reclamation area?
Absolutely,
It wouldn't be contaminated by this daily cover in a way that make it unusable for those purposes?
It needs to be cleaned daily.
Okay.
Anyway. Yeah, so regardless of its use, it has to be clean, the product has to be flushed out.
Okay, well, I think as it is now, when we have to do a project like that, we have to kind of contract with someone with a hydro seeder, so there may be some small benefits there of other uses as well.
You bet.
Okay. I support this.
Yeah, totally makes economic sense, and I think it'll be a lot less maintenance for Jonah and his team, not having to take care of the grinder, which it sounded like they spent a lot of time doing maintenance on the grinder.
And huge safety issue.
Yeah.
And you also mentioned getting an additional vehicle to allow fueling and service?
Correct. With all this additional equipment, fleet has got some demands on it. So we're going to require an extra vehicle to allow for fueling, service, and preventative maintenance. Now, the county already has a fleet service truck. However, if they're up at the landfill, it takes them out of service. So fleet has requested that we purchase, it's a pickup essentially, heavy-duty pickup, and then a fuel skid that we can put on our landfill pickups to fuel equipment that's out in the field, because a compactor just can't roll over and fill up, so.
Yeah.
Sure.
And a lube skid.
That would be a dual-purpose thing if Open Space and Trails was doing a project out somewhere and they need fuel delivered, the pickup truck could do something like that also?
If it's not.
Or do you think it would be used, would it just stay at the landfill? Do you really know?
Both of the units would definitely have some dual use. The fueling skid would probably be more for just a landfill. We do have some small fuel tanks and, cans that Open Space and Road and Bridge uses. This is more set up for that operation at the landfill.
Okay, so we need, it's just more that that number was not in the spreadsheet, or at least it wasn't highlighted the way the others were. And
It wasn't as highlighted. It was in the cost of everything.
the transition.
Right.
Okay.
Great.
Thank you.
Thank you. Thanks for waiting, bearing with us.
Thank you.
We appreciate your time.
Yeah.
John, are we meeting tomorrow at 11 or noon?
Do we know yet?
Do we know yet?
We don't
Ask the lawyer.
Yeah, I haven't had a chance to go away to the attorney, actually.
Okay.
The question was doing exec in the morning, if we have a posting requirement, or if our time subject to change would cover us to do exec.
Prior to our meeting.
So we would post,
Well, we have a regular meeting posted for tomorrow.
At noon.
But it starts at noon. So would it be better to have the exec at the end, or could we do it
no, we
at
could
11?
have the exec beforehand.
Since we're posted for the meeting and it's flexible.
And so it sounded like the preference of the board was to have
Do it
the
11,
exec
is
at
that
11.
good with everybody?
Yeah, as long as we hit the posting
Since we're doing
requirements.
so well in our timeframes ending our meetings, I think we should probably do it in the morning. Okay.
I'll waive on my open discussion items at this point.
Gosh, thank you.
Okay. Very good.
Your evaluation.
Thank you.
Waive your open discussion.
Yeah.
All right, thanks. See you guys tomorrow at 11.
All right, thank you, Grassroots. We're adjourned,
Yep.
Steve?
Yep, we're done.
Back and pick up a bunch of vases.
See everybody.